Women, Children's, and Families. We're glad to have two new members to that committee. We have Senator England, who is present by Zoom. And then we also have now added Senator Robin Robinson, and we're delighted to have her, who has a wealth of expertise that we're going to be hearing about in our next hearings in November. So we're super excited to have her. We're glad to have Senator Blunt joining us today and Representative Summers, who's here as well. The first thing that I kind of wanted the committee to and you've got it in front of you. And if you were listening and you would like a copy of this, you may email me and we will send you a copy of this. My email is nboyd@senate.ms.gov. So if you are wanting a copy of that, email me at Senate. You can email me at nboyd@senate.ms.gov, and we will send you a copy of kind of what we're going through right now. We are going through the legislative outcomes that have happened since the first study group that we had on women, children's, and families. As most of you know, 2 years ago, we started this study committee on this, and we've had a tremendous amount of legislation passed in these last 2 years. And to update the committee of where we are, it was even kind of a little overwhelming to me to kind of go through this. So we're going to kind of roll through this. I'm going to point to our chairman and the study committee if they want to add anything to this as we go through this. Our first thing that we did was the extension of postpartum coverage. We extended the previous Medicaid postpartum coverage from 60 days postpartum to 12 months postpartum. The eligibility for women to qualify for Medicaid after the pregnancy is confirmed are the same, and the new law only extended the length of time that those women could receive the covered healthcare services. We know that this was done 2 years ago in the 2023 session, and Senator Blackwell fought hard for this, and I'm going to ask him if there's anything he wants to add to this. Okay. Okay. Yeah. Senator Bart Williamson was a primary sponsor of the Mississippi Access to Maternal Assistance MAMA program. We're going to have the Attorney General here this afternoon to talk about that. And that's the legislation that created a website and a mobile app to promote information and services related to pregnancy, childbirth, and care for dependent children. The Attorney General's office agreed to step up and take on the coordination of that. We greatly are appreciative of that. And they're going to be here to testify about that. One of the things that led to this piece of legislation is that, and we welcome Senator Turner forward. One of the things that led to this legislation is we realized that there was no central depository of information. And we heard this over and over again in the committees that we had. So this was one of the things that we have helped to do this. And so she'll talk about that more this afternoon. Also, one of the things that we did too was the revisions to the baby drop-off and safe haven laws. The legislation revised our previous decisions for our previous information for babies drop-off laws. We extended the time period that the parent has to safely surrender their unharmed baby from 7 to 45 days. The law authorizes newborn safety devices that are commonly referred to as baby boxes at fire stations and hospitals that are open and staffed 24/7, as well as other safety features. It also gives the parent the option to call 911 and surrender their child at that level. And then we have 2 baby boxes that are installed and operational now in the state. One is at the Long Beach Fire Station, and the other is at the Simpson General Hospital in Mendenhall. And that we also believe we have 2 more in the works, and that is located at the fire station in Gluckstadt, and then a fire station in Gulfport. So those will be operational soon. We also had we authorized the task force on Mississippi's adoption and foster care system. And when Senator Wiggins comes in, I'm sure he has more, but we'll hear more about that from CPS today. But what we realized when we were doing the hearings that we did is we needed an entire task force just focused on a number of these provisions. And so that task force kind of dug in even further with in-depth studies on some things like that. We did revisions to the adoption statutes, the role and the funding of the guardian ad litems, the parent representation in youth court proceedings. And we're going to provide a more detailed summary of that as we go through some of our hearings that we have. Yes.
I'm sorry. Going back to number 3.
I don't think we have had any to date. I watched the national feed on that, and I have not seen one dropped off to date with that. So they're dropped off in a lot of other states. But I don't think I've seen one here yet. So, okay. We also did a revision to the laws mandating home study in certain adoption scenarios. We found that this was unduly burdensome sometimes to some of the foster care and adoption proceedings. So we gave the court some discretion in those manners, and we're monitoring that, and that so far has not been problematic. We also gave notification to the Attorney General's office when permanency plans were changed to TPR adoption, and that was to try to help speed the path to permanency much faster. Again, we're also monitoring that one. We also did an early intervention task force. We actually reauthorized that task force last year again, and this group has been studying very intensively what needs to be done in early intervention in the state. Our early intervention numbers were some of the lowest in the country. And so this task force has been looking at that. We also funded a pilot provider program that Mississippi State University is conducting. And you'll hear about that in the November hearings. We'll be focused on that. And so then the task force has completed their report, and they will give that report to us in November as we've continued to work on those issues. And we've also, Senator Blackwell and I have met with our MCOs in regards to that as well, trying to get some coordination in that. We also did an employer tax credit for providing childcare that some of y'all I know worked on, and it provides a 50% tax credit to employers providing dependent care for employees, either through childcare on-site or a childcare stipend of at least $6,000 to licensed entities providing childcare to the employee's child during work hours. We'll have the Department of Revenue that will give us the outcomes of that in one of our November hearings. We've also had the automatic suspension of child support obligations when incarcerated. It brought us in line with the federal guidelines of what we needed to do in regards to that. And that was something that was really required to get into compliance with federal guidelines. We also did an increase the adoption tax credits. And again, we'll have, we increased those to $10,000 for the adoption of a child residing within the state of Mississippi. And then we did a $5,000 tax credit for the adoption of any child residing outside the state of Mississippi. Again, DOR will be presenting us with how much they've seen in regards to that. We also did a foster parent bills of rights and responsibilities. We know that we have had, especially since COVID, we've had a number of families that have closed their homes to children that are in the foster care system. And so we wanted to make sure that those families had really some very enumerated rights that were spelled out to them, that if they were having difficulties with caseworkers or anything like that, that those families had some option. And I think there's some more work that we're still going to do on that. And the commissioner will be here today and we can ask her questions about that. But that's one of the things, as we heard from a lot of foster parents across the state, that we did do. The path to permanency. This legislation included multiple requests from CPS and to improve the youth court proceedings involving the children that are in custody with CPS, and maybe provided a more streamlined path to permanency. Our two judges that will present the report today that we're going to hear just a little bit later We worked with those judges extensively. We also worked with that task force in looking at all of that legislation. And so this was kind of a multi-year process and some of this, but one of the things that we did was we made CPS a necessary party at all stages of the legal proceedings involving a child in their custody. And this was a tremendous change in regards to this, because it made sure that CPS was involved at every step of the way for a child that was in their custody. We revised the members of the Mississippi Commission on Uniform Youth Court System and Procedures and tasked them with providing a report, which they will provide later this morning. The commission has completed their work, and we'll hear about those findings shortly. There was still lacking a complete split of CPS and DHS that would allow CPS to become a completely different independent agency. And there were some bureaucratic entanglements with that was really preventing the full operation of CPS. So we completed that process. We also gave tax credit for CPCs, our crisis pregnancy centers, transitional housing, and low-income healthcare. We increased the amount of tax credits allowed for contributions to the Crisis Pregnancy Center from 3.5 million to 10 million under the Pregnancy Resources Act. We created a new tax credit for contributions to organizations providing transitional housing for homeless people, 25 and under, homeless families, and or homeless and unwed pregnant mothers. The cap and the amount of tax credits is to be allocated as 10 million for businesses and 1 million for individuals. Again, in November, we'll hear from DOR on how that is proceeding. We created a tax credit for contributions organizations that contract with healthcare professionals to provide healthcare services to low-income residents of the state. The cap on that tax credit is allowed between 3 million for businesses and 1 million for individuals. Again, DOR will provide an update. And we created a tax credit equal to 50% of the amount of the federal income tax credit lawfully claimed by taxpayers for employment-related expenses such as childcare and the taxpayer's federal income tax return. Again, DOR will report. The legislation then from this past session, we did a presumptive eligibility for pregnant women. Senator Blackwell, it provides pregnant women with presumptive eligibility for Medicaid coverage based on the accountable family income of the woman, and it prevents coverage healthcare from being delayed for weeks while a woman waits for her Medicaid application to be processed. We had reports from across the state that was taking anywhere from 4 to 8 weeks. Senator Blackwell, correct me if I'm misstating that. And so we know that that we have more optimum outcomes for mother and child the quicker that mother gets into services while she's pregnant. So this is something that we initiated. We're having some problems with the approval of this at the federal level. And so we are working on this, and in November, we will have Medicaid here to give us an update and to see what we need to do in regards to this. But this is kind of an ongoing issue that we want to make sure that we do. The Foster Care and Adoption Task Force. And by the way, to the people who served on that task force and the volunteers from across the state who served on that, we owe you a huge debt of gratitude. The state does. All these task forces that people are serving on they are doing uncompensated. And we have some really valuable expertise on all of these task forces, and your state appreciates you. Your legislature really appreciates you because we know how much work you're doing on these task forces and chairing these task forces. So we cannot thank you enough for your work that you're doing on all of these. The legislature, on advice of this task force, made several revisions to the statutes regarding legal procedures involving CPS, such as we required a youth court to appoint counsel for indigent custodial parents or guardians that is a party in an abuse, neglect, or TPR proceeding. And we thought this was very important that everybody understood their rights going through. This was also a recommendation from a number of people to make sure that families understood what was going on and what was happening to them. So we think this was important. We require a minor child to be represented by counsel throughout the proceeding to make sure that the child's best interests are always at the forefront of the court. We require the court to consider a child's preference, if any, if the child is 14 years or older at the time of the TPR proceeding. Therefore, making sure that a very traumatized child feels like that they have some rights in that courtroom to be heard. And we learned from all of our experts it's incredibly important. We required the court to hold a hearing on the TPR petition. We did a revision of a neglected child to clearly state that the child is not neglected if a parent lacks the financial ability to provide food, clothing, and shelter. And so we'll have CPS in here this afternoon to kind of explain what we're doing to help those families when those are the particular issues going on. We revised the timeline and frequency of permanency hearings. We raised the adoption filing fee for children in CPS custody, therefore hoping to get more children to permanency placer and ease those financial burdens. We required training for intake officer, MySIDS and AOC to develop training materials in regards to that. We'll hear an update too today on their computer systems and where they are with getting a new up-to-date system. We've continued to provide funding on that. We've met now for over the summer for a post-secondary K-12 through post-secondary mental health task force that many of us have participated in. And it's a task force that studied the mental health among K-12 and post-secondary. We'll hear from, again, a number of people from across the state, a number of experts served in this, and we appreciate your service on all of that. And we had the responsibility of assessing current training, recommending changes, and determining where the gaps exist, and analyzing the successful resources of the programs in our state. You'll hear tomorrow on the results of that task force. They'll be presenting that to us. And then we also did we provided Senator Hickman's bill. Something that we did for foster families is that we provided free admission to state parks and museums for foster care children, and provided post-secondary transcripts for foster care and former foster care students that we had heard from our foster families and our foster children that this was a particularly difficult issue for them. We also have an audit of the Mississippi Youth Court Information Delivery System. Over their last couple of years, there's been some substantial concerns have been raised about the operation of that system. And then we have required the Administrator Director of Courts to audit that, to review the system and provide a copy of the audit and the report to the findings to the legislature. Final thing that we have listed on our list is we have done a revision to the Mississippi Rural Physician Scholarship Residency Program to include psychiatrists and child psychiatrists to try to help make sure that we are fulfilling the workforce gaps that we have in working with our children across the state. So that is just a brief rundown of the things that we have done. And anyway, so we will, that is what we did. That went a little faster than I thought it would, but I don't think I gave us much time to discuss. Anyway, we will, those are kind of the things we're doing. And the hearings too, just to let y'all know too, we will, today we will be focusing on child welfare. We'll have Commissioner Sanders will speak. We'll have General Fitch will speak, and then we'll have Carla Steckler from the Children's Advocacy Centers that will be speaking as well. We did not hear from her last time as a task force. They perform a very important role in the state when a child is in crisis and has to go to those child advocacy centers. So they'll be talking to us about that. On Thursday, we're going to have our sessions will focus on mental health, substance abuse, and incarceration. We did not hear from the last task force hearings we did from the Department of Mental Health. and they have a lot to share with us. So we'll have we'll have Director Bailey here with us. Then we'll have Melanie Medeiros from one of the community mental health centers. I think she's also head of their association. We also will have NCSL, National Conference of State Legislators. They'll be reporting to us on what we're going to be doing, what they have going across the country, and some really highlights of models maybe we should be looking at. And then we'll have the report of the post-secondary mental health task force. I think Leah Smith is going to be kind of giving us that overview of that. In November, we will be having a joint meeting with the labor force participation task force. We have a full day of looking at what we can do to help upskill women that are working very hard in our workforce, what we can do particularly in regards to our single mothers that are working at a 20% higher labor force participation rate, and what we can do to help those mothers, and then also looking at the barriers to employment and childcare issues. So those hearings will be looking at programs within the state that kind of do that. And then we will have that is on the 14th. So we'll have a full afternoon. That afternoon hearings will start at 1 o'clock that day. Then on the 18th and 19th of November, we will convene again. And we will be having a full day looking at healthcare once again, looking at Medicaid and the various issues associated with that, and kind of some updates of where we are in that. Those hearings will start that afternoon. And then the next day we have a potpourri of different issues that we'll be looking at, everything from we're going to be looking at domestic abuse. Yes, I mean, there's a whole potpourri of things. And that day, y'all are going to have to put on your ADHD caps with me, because we're going to be going in a various different directions on that. So anyway, we have a full days of hearings. So I hope you'll feel like your time is valued and that we will be getting with that. We're going to be a little bit early. They have walked in, and I'm going to go ahead and let them start just a few minutes early. Is that okay with y'all? Judge O'Neill, Judge Bevel, are y'all ready to go ahead? Okay. We have Judge O'Neill and Judge Bevel, who are county court judges and do a great deal with youth court. Judge O'Neill is from Madison County, and Judge Bevel is from Lee County, and we want to thank them. And if y'all want to sit and grab those mics right there, we'll let y'all go ahead and start. I want to personally thank these two ladies. They have come, I have pictures where they have come and sat with us. Many of y'all have seen them in the chamber, going through legislation line by line, looking at what the practical implications are when we do this legislation, what it will look like when they're administering a case. And they have been so gracious in providing us that information. So hopefully that the laws that we pass are practical to implement. And they have provided tremendous amounts of volunteer work to our commission. And I am so pleased to know you and thank you. And also too, because they'll take your phone calls at 9 and 10 o'clock at night, because our hours sometimes are a little crazy as we're doing legislation. And they'll take those phone calls. And even if they're in court, they'll say, I'll call you back just the moment I get out. And they do. So we are so grateful for what y'all done and for this commission that you're doing. And we're going to turn it over to y'all and let y'all present. Thank you. Turn it, that green light, make sure that green light is on.
Okay, I'm on now. Okay, thank you. Keep holding it. Yeah, it's green. Well, we want to say thank you for the invitation. We live in a world that is very private, and it is very, very welcoming to this world, so we can share with you, you know, and we appreciate the invitation today. I wanted to. Is that better? Thank you. I also want to thank you for allowing us to come on behalf of the commission. This has been over a year-long journey. We started here, I believe, in August, maybe of last year. It is a 20-plus commission that was appointed by the governor to look at several issues. And we are very proud to be here today to report on those. One of the main things that we looked at from the beginning was, would a uniform youth court system in Mississippi be desirable? I'm going to go ahead and give you a spoiler alert, and the answer is yes. And we're going to use the rest of this explaining why and showing you some information that we were blessed to gather. Ms. Stacy's going to talk about this, about all of the information that we were able to gather, and it's unprecedented. We just want to let y'all know that there's not been another group, I believe, that was given such access to financial information, judge information, to allow us to make this report and give you this good information. I just want to briefly touch on, I hope all of you received the report. We did forward it to the Lieutenant Governor for them to distribute. Just briefly outlining it, we looked at the best practices of a model system. What do we want this to look like? If we could paint with a magic brush, what would best practices look like? We went on to talk about what are our areas of non-uniformity? What are we not doing? And we went on to talk about why. Why in Mississippi is that not what's happening? Then we went and talked about the areas of desired uniformities. We all know best practices are best practices, but what do we want Mississippi to look like? And what are the very minimal things that we want to come out of this commission, even if there's not a structure change? In addition, we reviewed the current system. We took a really in-depth look of what's going on here, and there is lots of data to back up what we have found. In addition, and why most of you are all here, is that we reviewed some plans. I will tell you from day one, we met and we had lots and lots of ideas. And what the vote came down to is we narrowed it down to 3. And I know you're like, you didn't give me 1. I understand that. But there is a lot of information here for you to take as our legislative body, to take that information that we are giving you and make good decisions. And that is what we were going to speak about here today.
Let me add that we're going to hopefully take about 15 minutes, and there's no way we could address everything in the report. So we pulled out the highlights and would encourage you to spend some time going through the report. If in doing that you find something that we haven't covered, please feel free to call us, because we can talk ad nauseum. I'm sure you know.
So I'm not sure who's.
How do we click?
How do we click? Or is somebody, are you the clicker man over there? Thank you very much. I'll just motion to you. We will begin by just looking at our current youth court system and what it looks like in Mississippi. So we have 24 county courts. Those county judges are elected and they are full-time. We handle cases from protection cases, which are CPS cases, from the moment I take them into custody until they are TPR'd.
Hold on,
Yes.
got a question.
Sorry.
Needless to say, I don't know how any of this works.
There we go. I'm going to get to that.
That's the next slide.
Yeah, that's our next slide. Just want to generally tell you that youth court is handled by 24 county courts. Those are elected from individual counties. We have 56 part-time referee courts. What that means is that usually a senior chancery judge appoints an attorney, and that attorney becomes the youth court judge. They are held to the same responsibilities that I do, and I work full-time. I will say that those attorneys those judges handle cases up to the point where they change the plan to TPR. They cannot TPR cases. And this is an important note. We'll talk about that in just a little bit. We also have 2 chancellors here in Mississippi who chose to keep that themselves. They handle Chancery Court. I mean, they handle their youth courts. And I believe that is Judge Giles and Judge Sheldon, I believe.
Judge Giles does 2.
Yeah.
Judge Sheldon is very active in her
Yeah,
court.
but Judge Giles handles it herself. So next slide. To your question, what county courts are established once a county population receives 50,000 people. That is statutory. You must have a county court system at that point. Lafayette and Oktibbeha are our latest 2 that have joined us. And also, you at any time, if you are a county, there are statutes that allow you to request the legislature to establish a county court. And there are several counties that have went ahead and did that, even though they don't meet the population. This is a very good point to explain to you that population does not rule our world. It's referrals is what rules our world. What does it look like? A very small county could have a very high delinquency docket, even though they have a very small population. So that's not just what we look at. What cases come to youth court? So I handle basically 3 things, mostly. I handle if a child commits a crime. We just listed some of the things that we deal with. This is not all of the crimes we do, but we handle lots of felonies. We handle lots of misdemeanor cases. Children are committing very serious crimes. And then I have children who are abused or neglected. I work with the Department of Child Protection Services on those cases. They're physically abused, sexually abused, emotionally, educationally, and physically abused. The third thing that we really do a lot of is we do child in need of supervision or truant children. In where I live, we have about 14,000 children attending school on 3 school systems with about 36 campuses. And I'm in charge of making sure all those children go to school. And so that in and of itself is a full-time job if we didn't do anything else. We have dependent children, children in need of special care, which are very small things such as we need to commit a child. This is normally what that looks like. You may change the slide. Thank you. I told you that population does not run my world, referral does. That is what we look at. Every one of those numbers stands for a child. Okay, so delinquency referrals is 18,212 crimes were committed by children in the state of Mississippi in 2023 and that were referred to the youth court. As you can see on the right-hand side, county court handled 72% of those cases. Referee courts, a little less than 30. So then we have 46,353 children who were, those are referrals. Those are times when people picked up the hotline and they called CPS and they said, we think there's a problem. And that is the number that the state of Mississippi and 82 counties, our youth courts deal with. As you will see, county courts deal with 63% of that caseload, and then referee counties come in a little under 40. So that kind of gives you a snapshot as of right now, what we're looking at as far as the county referee divide on the number of cases we are carrying and also the amount of workload we have to do.
All right, next slide. So one thing that is the mystery behind youth court that really only 2 or 3 people understand this process in each county is the intake process. Those referrals, the allegations, it's a referral, comes to the youth court. And by statute, every county should have an intake officer. That intake officer is not a law enforcement officer, they're just called officer, but that intake person literally puts that allegation into our MyKids software system. And then what happens is that information is, by statute, is supposed to go to an intake unit. That intake unit is supposed to review, make inquiry, do more investigation if necessary, and make a recommendation to the judge as to what should happen. Should this case take no action? Should it be handled informally? Should it be handled formally with a petition and a trial? And so that intake unit is very critical to the whole process. But the judge has to sign an order for every referral. And so judges don't just sign orders without knowing what the case is. And so the 64,606 referrals that came to Mississippi youth courts, a youth court judge signed an order saying what should happen to each of those cases. No other court system is involved in what happens before a case is filed, except the youth court. And the youth court judges by statute are responsible to make sure that that is done appropriately. So the whole youth court process, and this is the umbrella of what youth court judges do. They do the intake part. So think grand jury, okay? And then they do the trial. And in youth court, we call everything a different word, adjudication disposition. That's basically trial and sentencing. And then unlike other court systems, we don't get rid of the case after the trial. In a delinquency case, we're overseeing the probation too. And in an abuse and neglect case, we're overseeing that family until they get reunified or until the child gets adopted or some other permanent living situation like durable legal custody. So the youth court judge is responsible from the time the allegation is made until final resolution. Next slide. I wanted to give you a comparison between what we do in youth court and what circuit court does in circuit court. And I understand circuit court deals with all felonies, so I'm not trying to make that comparison. But last year, the youth court delinquent cases were 18,212 in 2023. The criminal circuit courts in Mississippi had 19,000 cases, most of which pled guilty. There aren't as many, obviously their plea day is a lot longer than trials. And most of our cases are admissions as well. However, we are doing the grand jury, we're doing the trial, and we are also MDOC for all practical purposes because we don't have an MDOC to come in. Now, we do have DYS, and I'm going to cover that. Was there a question?
19,000, do they represent cases that have been disposed of or are they filings?
That number represents when the case started. So in 2023, the case started, it was filed in circuit court or the referral was received in 2023. So as far as disposed of, that's another thing, like if it came in, the trial probably happened. Whether or not that child is still on probation is a different question. Okay. Her question?
I'd like to see those cases broken down by numbers per county, if y'all have that information somewhere.
We do have that number. In the report that we filed in the back, there's about 50 pages or so of charts by county, by petition, by delinquency, by abuse, and you can know exactly how many were in each county.
Okay, so where is that report? Okay, thank you. So look in the back in the chart.
In the back,
Okay.
they're charts. If you print the report, it's going to print in 11 by 10, but if the charts are legal size because the numbers are bigger. Next slide. I wanted to highlight this. Our commission, if the youth court judges were sitting in this room, all of them would say to you, detention is a problem. We have 17 detention centers in the state of Mississippi for juveniles. Those are owned by the counties. They are operated by counties, and it's up to the county whether or not they will accept youth out of their county. They paid for it, they're running it, and it's their prerogative to do that. For the rest of us who don't have a detention center, when I get that call of a domestic violence in the middle of the night, and I need to detain a youth, my next question is, do I have a bed? And so my law enforcement or my court administrator goes down the list. We call Yazoo first. If they don't have a bed, because these aren't big facilities, and they may not have staff. Certainly if I have a girl, it's a lot harder. So we have 17 detention centers. I have about 4 that are available to me in Madison County because a lot of those detention centers are too small. They don't take out-of-county kids. My county pays between $150 to $325 a night to house that young person in detention. And when we surveyed our youth court judges, I think about 50% said that they had in their moment of need, did not have a detention center and had to just tell law enforcement, I'm sorry, send them back home. Bad things happen when you have to not have a detention center. Next slide.
I would like to
Go
to
back.
point out, no.
Okay.
No, I think that was right, was it? Yeah. Want to talk about a little bit more following up on the youth court judge involvement. So most of you, if you are attorneys, or even if you're not attorneys, you might be a little, I lost my word. You may know a little bit about circuit court or what you see on TV. You will notice that they do not deal in hours and days, except it's Matlock or HVU. They do in hours and days. But we have so many deadlines that are placed on us by statute. I am not complaining about these deadlines. These deadlines bring about good results because the more we see these families, the more we see these children, the better results we get. But just to bring your attention, 48 hours, 30 days, 14 days, 120 days, every 2 weeks, you will note that those timelines do not lend to support part-time work. It just doesn't. We have, and I want to explain that many of these people that are meeting these deadlines are doing it with little or no staff. We're going to talk about that a little bit more down, but just keep in mind that you are ordering people through these laws to make these deadlines, and sometimes it's impossible. I'm just going to be really honest with you. I have a fellow colleague across the waterway in Etowamba. She does not have a administrative staff person to help her. And we're going to talk about that a little bit more. She has a chancery clerk who does her very best and lends her staff, but we are in a really big situation with this, that these timelines require full-time attention.
Next.
I'm sure. Do you want to go to that one?
Oh, is that mine?
Yeah.
All right, so the map on the right is the most recent map from the Mississippi Department of Child Protection Services. And I know that's hard to read, you can find that online. Each county has children that are in CPS custody. Those are the children that we are required to have frequent hearings on, review hearings. You know, parents, are you doing what you're supposed to do to get your kids back? Are we closer to TPR? What are we doing with these children? The recent change in the law requires, if they're under 3 years old, to have those hearings every 60 days. And we're here to tell you, we think frequent hearings are a good thing, but we're also here to tell you that a part-time attorney who's having court once a month cannot meet this requirement. It is impossible. And they're going to have court more times a month. In the commission report, it shows you what the salaries of our referees are. The range is $5,000 a year to $54,000 a year, with the average being in the middle. They cannot do what is being asked of them to do.
I want to say also that this commission did not stand in judgment of referees.
No.
We are here doing the work, and those people should be applauded every single day. A lot of the referees I know count it as their community service. They're not getting paid. They're taking time away from their offices. So we want to make that very clear to everyone that is listening here today that they are the champions in the work that we do, but they need help.
One point before we leave the screen, we said earlier that population doesn't really have any correlation to caseload. And that's why we want you to look at what we've put in the report, to look at county by county. For instance, Alcorn County has 80 children in custody. That requires 80 hearings every 60 days or every 120 days. Hancock County has a county court, they have 81. Prentice has 97 children in CPS custody.
Who is a referee court?
And Pearl River, who is a county court, has 97 children in custody. Rankin and Madison counties were in the 40s, 50s, children in custody. And so please look at the real numbers if you decide to group counties together, because the number of children in custody determines how many frequent hearings. And of course, the delinquency numbers require multiple hearings as well. Next slide.
I get asked all the time, well, are you not a judge? Can you not have court every day? And I say, yeah, that'd be great, but I'm not the only person it takes to have court. I just want to kind of let you look at this. We kind of put this together. So if I'm going to hold a CPS hearing, these are all the people that I have to have there. I have to have my administrator that basically is my right hand telling people to come and go and move. And when are we going to set this next case? She's on my kids constantly looking up information. You will see that we have the child in the middle here. She has a guardian ad litem, which is an attorney appointed to represent her best interest. The law has changed in the past several years, and they can also have an attorney appointed for them if they are old enough that their stated interests are different from their best interests. So I'm looking at two attorneys sometimes when I'm looking at a child. We have a prosecutor that is bringing the petitions before the court. We have CPS. The law also changed, and CPS now is allowed to be represented. My county is one of the counties in Lee County that has the pilot program where I've almost had her a year now that the CPS attorney has come, and it has been a wonderful thing. I truly hope that that continues to grow, that program. We go over to the mother's side and the father's side. They each have an attorney. This last session, it was passed that the custodial parent must have a parent attorney. That is a new must. It was always best practice and lots of people followed it, but it's a must now. And you'll see the little man over in the left. He is not to be taken lightly. There are a lot of youth courts that are operating without bailiffs and security. I speak on behalf of those people here today because they need to be protected while they are doing their work. So next slide. We put the dollar signs on there to tell you who all is being paid for by the counties at this point. The judge, I will tell you that AOC, if you have a county court judge, is reimbursing you about 30% of the salaries out of your filing fees. AOC takes the filing fee, turns around and reimburses the county for that percent of my salary. Intake administrator, we will hear a little bit about the support funds that are given to us. We do use some of those for the intake. The attorneys are paid for by the counties, and the guardian ad litems and the prosecutors are paid for by the county.
Certainly not every parent's entitled to a free attorney. It's an indigent parent, but as you can probably assume, most of our abuse neglect parents qualify. I mean, we're taking children because of neglect, sometimes because of abuse too, but in most cases, the counties are having to provide attorneys for the parents because they cannot afford an attorney on their own. So there are some private attorneys who practice in youth court. So we don't want to give the impression that every attorney is paid for by the county.
Exactly. I apologize for that.
But no, it's okay.
Next slide. If I have a delinquency case, which means a child has committed a crime, We have the child, they have an attorney, we have a prosecutor. The state provides the Department of Youth Services that deals with probation and other things. And then lots of counties have their own counselors, especially some of the bigger counties, because they are having to deal with intake, because DYS is not authorized to be the intake unit. Again, bailiff and an intake administrator. Next one. Again, that just kind of shows where the money is coming from at this time. It is for through the county budgets.
And opposite of the abuse and neglect, our children, well, the attorneys for children are always paid for by the county, but certainly the public defender in any delinquency cases.
I want to also say that this report highlights things that has to do with all of these people. And that was a charge that was asked to us from our legislative charge. Lack of security, lack of intake officers, the attorney shortages in the state of Mississippi that deal with youth court, and roles of prosecutors and how that looks.
Next slide.
Okay, I told you that all of those people, all of that work that's being done, there are, according to a survey that we sent out through the commission, we were able to document that 38 referee counties are doing this with no administrative staff.
And that is supported by the budgetary information that we also received.
So we did gather the budgets from the different counties, and we're able to look at those. When you look at that and you think, how in the world? Well, I'll tell you that a lot of referee counties look to the state agency, DYS, CPS, to do a lot of the work that is not theirs to do administratively. Keep up with your docket. There are some counties that they say, we're sitting here and you bring your cases, you know, kind of like Chancery Court does. It's a user-run system. There's just a lot of things that administrative staff has to take care of that cannot be delegated to state agencies or Chancery clerk staff, even in that. I have talked to a lot of referees. My heart is the referee system. I was a staff attorney for a county court judge, but then I spent 5 years in a referee county. And these people do the yeoman's work, like I said, but almost every one of them I talked to said, just give us some staff. If you're going to leave us here like this, give us some staff. And so we've really tried to work within this to highlight that also.
Next slide. Of all the sentences in our commission report, and it was, youth courts require more staff than any other court system because we have this intake function and we have this probation function, yet they are the least funded. So I'm going to talk just a couple minutes about money. Next slide. We did gather, I did a Freedom of Information request to every county asking for their youth court budget, exclusive of what they spend on their detention center. They spend millions on their detention centers, but just what you spend on your youth court budget. The counties of Mississippi are putting over $19 million into their youth court budgets. And I didn't ask for pie in the sky budgets. I asked for expenditures. So that's what they're spending already, the county governments. What is coming from the state through AOC support funds is $2.5 million, and that's it. Next slide. How that is divided when AOC sends that out to the counties, they're doing it by county or referee, and that follows the population. So population-wise, the counties are getting sort of an even share, except that $68,000 comes to each county court. Well, I can use that money and I can hire an intake officer and pay their benefits and that sort of thing. But $15,000 goes to each referee court. That's not enough money to hire a person. It's just not. Certainly not a full-time person when you consider taxes and benefits and stuff. So if the legislature wants to support the youth court system, no matter what kind of system it is, at a bare minimum, we would ask that you give enough money to each county to hire one full-time person to be that intake court administrator so that judges are not sitting alone on the bench having to manage all of this without any help and looking at thousands of abuse and neglect cases, making decisions. Next slide. I don't want to make it look like these agencies are not doing their part. And the legislature is, and the state is funding truancy officers through the Department of Education and mental health people through and DMH and youth services, social workers who come in and say, here's my recommendation because of their social history. They are testifying in our courts and they are providing services to our families outside of court, but they are not court officers and they are not doing intake. They are sending referrals to us and then it's up to the youth courts to manage that. Next slide. We did gather information and we had 18 counties who did not respond, and that's for various reasons. Some counties didn't have good county government to be organized. They didn't know what to do with, I won't say why they didn't. We asked and followed up and we didn't get it from 18 counties, and those were mostly small counties, but everyone else responded. The average county court, youth court budget, the average was $630,325 a year. The range, because we do have smaller counties under 50,000 who have elected over the years to have a county court, and they have budgets as well, the smallest being 89,930. Obviously, you can probably guess where the largest county court budget came in. I don't know if that's Harrison or Hines, but one of those two topped the list. But the average youth court budget, and again, that is not including a detention center, so keep that in mind. But I wanted also for you to understand that the referee counties, they're spending money on their youth courts. They're not spending enough to perhaps provide an intake officer in a lot of those counties, but they are spending money. As we get into the plans later, most of the plans create some sort of district where you combine those smaller counties, whether you call it a county district or a chancery district. But the counties, 132,000 is not enough to run a court, but you put several counties together, they're already paying money, and together their money could be used to create a whole youth court rather than several partial youth courts. Next.
Okay, getting to the meat of kind of why we're here was about what do we recommend as to a court system. The first thing we had to talk about and break down is, like I told you, we went over what do we want, what is needed. The first thing we came to a recommendation is that every family needs access to a full-time elected judge. I'm not talking to you about a court system right now. I am telling you that we feel that children deserve that. They have intake responsibilities. These are all the things that that full-time judge has to do. We looked at that $60,000 intake and referral number. Those have to be taken care of. I sign an order on everyone that comes through my court. You've got to be available to hear these emergency hearings. They're on these very short timelines. You saw the hours, the days, the weeks. Caseload volume demands full-time attention. That has nothing to do with population. Make sure if you've heard anything here today, please hear that. Time required to develop and oversee probationary programs. Right now, the Department of Youth Services does not have a statewide diversionary program. We have DYS officers that use other resources, but there is, like MDOC has a statewide probation service. We do not have that for children. So what that means is that my staff and I are looking to other groups and also within ourselves to make up things, to make up these programs. I'm looking for community people to come in to be mentors. All of that takes time. That doesn't just happen. And it has nothing to do with me sitting on a bench and hearing cases. Also, time to convene community support. Whether you like it or not, your face is the face of the youth court that you serve. My credibility in the community is what helps me gain resources to serve my families. And that's just the long and short of it. And that does not come with me sitting on a bench and signing orders. I'm at meetings, I'm at community functions, I'm begging Senator McMahon for money. I'm, I am constantly out there trying to make our courts better. People need time to do that. Also, compliance with the hearing guidelines. I'm not going to rant on that anymore. You saw what that was.
Judge Bevel, just
Yes.
to make it clear for the committee and anybody that's listening, youth court is different in the fact of you may be at your hospital when the kid is brought, you may be called to the hospital. You're rolling the, and I think we think about judges and I think we think about y'all on a bench. And that is where you're doing everything is on a bench in your office. But your office literally may be the
Where's my
emergency.
phone?
Yeah, it may be the emergency room. It may, because y'all are called oftentimes to the hospital, I know. It may be various different places that I probably even have no idea where all the different places are. But your job, it's not just in your bench or on the office. Can you explain that a little bit more?
Yes.
Let me say, pretty much, I'm not really called to the hospital, but the hospital calls me. We get calls 24/7. I've taken calls all over the world, literally, in all kind of weird places. When an airplane's about to take off, you got to talk quick because we're about to take off. I turn my phone off.
We are on call 24/7. You cannot take a child into custody for CPS unless you hear my voice or my designee's voice to say it's okay.
I know like my county court judge is called to the hospital. She is called, literally has been called on the side of the road for a child out there with law enforcement. She's called multiple places. Her job is not on the bench. And that's where I think there's a little bit of a different misperception as to what the youth court judge role is. County
You're
court
exactly
judge.
correct. We deal with everything. I spent this morning sitting in her office trying to navigate how to get a child transported from the Oak Circle to CARES. You were involved in things you would not believe you were getting involved in. And you are right. We are on call for all different kind of things and we respond to all different kind of things that have nothing to do with us sitting on a bench.
Okay, also, as you're doing your job, which, is, unless you operate in this world, you don't realize is y'all are also then trying to find placement for these children, especially when it comes to mental health placements, which is on this. And y'all are literally y'all are there calling placements, trying to find them placements. Y'all are trying to find the circumstances that a circuit judge or a chancery judge is not trying to navigate those things as well. Is that correct?
Yes, we assist state agencies in whatever way that they ask us to when it comes to placement. I have children that are in hotels basically all the time in Lee County. We are dealing with how are we feeding them? Where are they going to the next appointment? All of those things. And I will tell you that judges get involved at any given day. I think we all may be dealing with MBI. We may be dealing with a terroristic threat. We may be dealing with the hotel that has called me that has kicked out my child.
They're there because there's no foster home.
Yes,
And there's no
sorry.
mental health facility. And no one will take this child who is now in state custody. And so what happens, because we have nowhere to put them, they go with a sitter to the hotel. And that can lead to tragic consequences when you take a child, a teenager, who already is misbehaving, but they're also neglected or abused, and you put them in a hotel with a sitter. Unfortunately, tragically, one of my kids that was in that hotel was raped, was brutally attacked at the hotel, ended up in ICU. She is okay now, but hotels are not the places that we need to house our children who have behavior problems as well as mental health problems. So
If you would like to call us to
That's a
come
whole-
back, we could stay a whole afternoon and talk to you about all of that with mental health. But the point that you are making is you are exactly correct. We are called to the highways and the byways and to the hospitals and to the CPS offices and to all different kind of things to take care of it. And every judge handles that differently. I will say that. And it depends on how your state agencies are staffed also, about my involvement a lot of times. If I have a strong CPS going in Lee County at that time, I may not have to deal with a lot of those things. But a lot of judges are called to deal with things that maybe you and I don't deal with, but because they don't have strong staff state agencies to do some of that kind of work.
Next slide.
Yes. Okay, we are going to go over briefly, I know we're almost out of time, but the proposed court system structures that we looked at, there was 3 of them. And some of you are not, these are not new to you, but some of them they are. The county court district, and I know Senator Wiggins is on here, we looked at basically some of the bills that he has put forward and took that, and what that looks like is, well, let me just go ahead and go to the next slide. It leaves the current 24 county courts intact, and then it creates county court districts which containing 2 to 3 counties from the remaining counties. Now, I want to be very clear, this map is what had already been introduced to the legislature. We did not tinker with that. We just put that up there to show that that plan had already been introduced. We did not get into, as the commission, of whether Lowndes County needed to be put with this county or how all of that needed to work. But that is just a map of what currently was put before the legislature. This also shares cost burden between the counties and the newly created districts. And again, this is based on the previous bills introducing a county court plan.
One thing we spent a lot of time on in our commission, like complete work days, was really looking at advantages and disadvantages, because we wanted to just not come at this with our own personal opinions. I'm a county court judge. I love county court. I think it is serves a lot of purposes. It's where law meets equity, and I think that's what youth court is. But we tried to come at this as objective as possible. And so advantages and disadvantages were not, everyone is not a consensus of every commission member. It was a collective, here's what we think. The county court plan calls for about 44 judges to handle the state's youth court. And that is done based on caseload, manageable caseloads. Obviously, the disadvantages, I'm sure if you've been around the legislature, you could probably make this list yourself as all the reasons that it hadn't passed in the past. But I want to draw your attention, county court can't do adoptions yet unless the legislature does a change, which we addressed that in our commission report as well. So you could, and obviously we fleshed those out in the report. So next slide.
The Chancery Court Plan, this was first introduced in the executive budget recommendation by Governor Reeves during the session last year. This was something that had not been put forward, and it removes youth court jurisdiction from county courts altogether and makes a youth court division in each of the 20 Chancery Court districts. Basically, county court would be removed, youth court would be removed from county court and be placed in the Chancery Court. That cost burden would shift to the state. That would be, we didn't get a lot into the money, but that is how that would work. The state would take over the youth court because it would be dealt with just like the other circuit and Chancery courts.
All right.
I will say this, that the executive budget recommendation said approximately 20 judges. That represents the 20 Chancery Court districts. Let's take Lee County. Lee County, I am a full-time judge. There are 9, I believe, counties in my district, which is a large district, but it would take at least 3 judges, if not 4, to do the youth court work in our district. So it can't just be one per Chancery Court district.
Next slide. And I think that was the main objection. It was sort of a OMG moment when that came out last year, because those of us who live in youth court were like, there's no way that one person can do an entire Chancery district. I think the disadvantage, the main disadvantage, I think, if I had to highlight one disadvantage, and of course, I'm obviously a county court judge, so I'm a little biased. I'll just be transparent about that, is that this doesn't really consider the delinquency side of our docket. Our delinquency side is, even though we're still acting in the best interest of the child, we also have public safety to consider, and rehabilitation of juveniles. The Chancery, if you practice law in Chancery, Chancery is sort of a let's change custody and it's the next case. And they don't stick with families and try to make things better. They don't rehabilitate people in Chancery Court. Not that a youth court judge couldn't do that, but it would give a uniform system, and it would unburden the counties as far as the cost of youth court.
And we know when we talk about the number of judges, that is something that would have to be fleshed out. We talked about the referrals. The county court plan is brand new. It's a brand new idea, and there was very little given in the budget recommendation. There were some meetings, I think, to flesh that out more. I'm sorry, Chancery Court. There were meetings, I believe, held to flesh that out more, and but those were not actually published recommendations. So if you went with that plan, anything can be changed. We just have to figure out what that looks like.
There is a chart in the back of your commission report that takes each Chancery district and sorts it out by population, so that you can kind of see what each Chancery district would look like as far as caseloads.
We know we're short on time.
I'm sorry.
But that's okay.
Last one.
The last one, and this was a very interesting plan, because we took possibly the best of both worlds. And what we did is, it's called a hybrid county Chancery plan, which means you leave the county courts intact that are there now. And then the chancellors basically would take in the referee work. Now, I'm not saying that the chancellor that is there right now can do that, because I am here to tell you that lots of chancellors are maxed just like youth court judges. But that might be the opportunity to have a newly elected chancellor that dealt just with the youth court system. So it would replace the referee system with new or existing chancellors to provide over youth court. Cost burden is shared between the counties and state budgets. We will have some county courts, and then we would have some Chancery judges. And I stated we may need additional. Comment on the next slide.
Again, we just took the advantages and disadvantages. I think the best advantage is that it draws from the best of both of the other plans and works to make it a shared thing. It would still be a full-time elected judge. So your uniformity comes in the fact that you have a full-time elected judge in every county in Mississippi. But in those larger counties that need more infrastructure in their court system, you're allowing the county to take ownership in that. And in the smaller counties that either can't afford the infrastructure, you're allowing them to bind together, and the state is helping them more. So last slide.
So we want to talk to you just a second. Court structure is one thing, but what we do every day is another thing. We need help with a lot of things in the youth court system that have nothing to do with who the judicial officer is. And those are what we're calling these minimal action points. Even if we end up here this same time next year and we don't have a change, we're asking you to please prioritize some of these things. As you saw, $2.5 million is given to the individual courts for their court structure. We're asking you please to consider to increase that. Referee compensation. We talked about this a lot. I mean, at the very minimal, they should be making what a justice court judge makes in their area. I mean, they are doing part-time work on a full-time basis is what we talked about. Reimbursement, talking about the states possibly reimbursing the counties for the complete judicial officer salary, state detention centers. We've got to talk about that. We are having people released into the community that should not be there. We have got to either come up with, we couldn't come up with the fact that we could have regionals supported by the county because, to be very honest, since COVID, a lot of your regional facilities are not big, they're just not manned. There's not enough people to work them. So even if I in Lee County wanted to become a regional jail, I really don't have the manpower to do that. And so looking at what the state could do to possibly look at that. And then probation and rehabilitation. Statewide funding for diversion, life skills, alternative education. We really need to look at a GED path for these children. We have every child cannot go and does not flourish in a traditional educational environment. We need to look at how we can fund those children and funnel those children to be successful parts. We have great CTE centers around the state, but our children that we deal with in youth court still sometimes that is not an available path. We need to look at alternative education in the state of Mississippi along with probation programs.
If we want to affect our prison population in the future, we must address our delinquency population now.
Very true.
If you look at the numbers of delinquencies, that is, the delinquents we see today are the inmates of tomorrow. Let's rehabilitate them now while they are juveniles with education and life skills and diversion programs so that we don't have to fund them in prison. And that's the end of our report. Thank you.
I do want to say that, and I've said this in the report, hard problems come with hard solutions. Y'all deal with that every single day because everybody that comes to talk to you wants $1, they want to vote, they need something. We are not lost at that. We are very mature people who have lived in this state for a long time, but we are asking you to please consider making the youth courts a priority when it comes to looking this session at maybe even a structure change, but if not, some minimal action points that can help us do our job better. And we thank you very much for allowing us to come speak today. We have a hard copy of this to give to all of you, and we can give that out before we leave.
I'm going to let everybody ask questions. I want to thank y'all because this has been an ongoing issue. And I appreciate the breadth of your report. It is long but good. And y'all have really done a lot of great work there. The one thing I think I'll caution with all of us is they realized that there is no one perfect solution, but we truly cannot let perfection be the enemy of good here. And so I appreciate that you laid out the options for us in the report. And knowing that when we create a solution, it may not be perfect, but I think that I appreciate y'all because Commissioner Sanders testified 2 years ago to the fact that one of the most important things that we can do to help our youth in CPS and help our delinquent youth and all of that is create a more uniform youth court system, that it was absolutely essential for the state to do that, to help families and children in this process. So I appreciate y'all doing that. The other thing I want to see, this has been going on in our youth mental health task force as well, is there is a severe lack, I'm understanding, of facilities in our state that work with youth who have mental health issues. And do y'all see that as well?
I'm going to go first and I'll let you go for next. Yes. We are having children that, for a very crude word, let me go back. Let me start over. We have children that are not allowed to be put in facilities any longer. These are private facilities, okay? I have a child who needs mental health problems. I need to they have to come through the acute door, which means it's a private facility. that I'm asking them to take to do an assessment, basically of this child to see what they need. They have to meet criteria due to Medicaid. They have to be homicidal, suicidal within such time frame. It would be great if they could get there, but some of these children's behaviors are such that they cannot go there because they have hurt people in the past. They have ruined things there. And I understand that. I get it. They run a business, and I'm not trying to belittle that part. But what are my other options? You're like, okay, so you can't send them there. What do? I don't have anywhere else. That's it.
It's a monthly occurrence that I have parents weeping in my courtroom, scared to bring their children home because they're scared of their children, and I have nowhere to send them. And so I have to send them home. And they lock their doors at night so that the children can't get to them, and they turn their alarm on so the children don't leave the house without someone knowing, because I have nowhere for them to go.
Well,
So-
and you ask, what can the state do? I know that last year, y'all were very gracious to give $25 million to CARES in a quasi-governmental private. That's not, we're looking at that to be, I think they said that, if I'm not mistaken, and correct me if I'm wrong, they guarantee maybe 20 beds to CPS. I have 5 right now in Lee County. That I could fill you up at least 25% of those beds today. That is true. That is great that that is happening, but we have nowhere to put these children. The state hospital, you say, well, just commit them. Okay, I do. We do commit children, but Oak Circle is not set up to hold these children long-term. It's not like when you commit an adult, they possibly could stay, for a longer period of time. This is not set up for a place for them to live. These children are going to have a place to live, to function, because as much as we do not say children don't need to be institutionalized, we as the court system are trying to gently say we have children that have to be institutionalized due to safety concerns for the society and for their families, just like what you said. We
Yes.
have to have places for them to go.
STF on the coast is awesome, and if we had one of those in every region, that'd be incredible. But I don't know the answer to the question, but
One thing that I do want to say, Nicole, is that I would love for y'all to consider supporting the Department of Mental Health along with the community health centers, because I had a chance to be on a task force with several of those people. And in your county where you live, if there is an adult who has a mental health crisis, there are beds that they can go stay in, and they can hold them there until maybe they can go to the mental health facilities they need to go to. There is mobile crisis units that go out to these people's homes and help your constituents navigate, because this is a hard world to navigate mental health. There is no such thing in the state of Mississippi, except I believe that Judge Hicks in Hinds County has a set of beds of 4 or 5. I can't remember. It's a very small set.
Some of the crisis center, some of the community mental health centers do have crisis beds for children, and then have their crisis intervention teams. And we're actually going to talk about that tomorrow.
Yep.
That will go out and help and the youth as well. So, and we'll
Those-
talk about that tomorrow.
You're correct. They're not in all of our
Not in
counties,
all.
but they also need to be ramped up and need to be trained just for children, because we have that issue also. But anything you can do to support that, that would really help us, because what people don't understand is that I am not a mental health therapist. And to be honest, CPS are not mental health therapists. They are social workers. I am a judge. And I am asking the agencies that handle these specific needs to take ownership of those needs and allow us to send our children to you and be properly taken care of. CPS is not a hotel. I'm not a transport agency. We have places like that. So we just need some more ownership of different areas in government to help us with these problems.
Thank you. Questions?
I have one question. I guess I was saving mine to the end, but there's on the, I think it was one of the first slides that you showed, and it juxtaposed county courts versus referee courts and the amount of cases that they have, I guess CPS related versus delinquency. My question is on delinquency, and I don't know I didn't get the population breakdown. I understand that we have far more referee courts, but I don't know the population that they serve versus the population that county courts serve. And I know you said population doesn't matter, but why is there such a disparity between the delinquency cases that you think county courts are seeing versus the ones that referee courts are seeing? And I think I have an answer because I work in youth court, but I want to know.
The population, excuse me, the population, even though there are 56 referee courts, the population pretty much mirrors what that looks like as far as delinquency. The
county courts serve our higher population
right.
places. So
more urban.
and more urban. And so we carry more of that caseload as a whole due to the referral numbers.
And I guess, well, maybe not what I was thinking, but I know in some smaller counties, particularly places that I work in, is that law enforcement and school districts and these people are not actually referring cases because of the issues that they're having in the intake process and the issue that you're having with not being able to really do anything from a sense of there's no beds here.
Definitely.
And I know counties where they just don't refer them anymore.
It's like, why waste the time if they're not going to do anything? I've heard that.
And some people who don't have detention centers. I have a detention center. I can't imagine having a delinquency docket without a detention center. Even though I may not give every child detention, there still has to be something that is a consequence. And if that county holds no consequence, such as that kind of thing, it's hard.
And that's what I was wondering. Are you seeing that in across? One final question on the intake persons. You talked about intake, and I guess you were condensing it, wasn't able to get into the final plan. In your final plan, and what you think would be, what you guys came up with, what you think would be the best alternative to what we're doing now, where would these new intake officers that you discussed currently in the presentation fall? Like, who would they fall under?
The
Who's
judge.
hiring them? What offers are they going into?
I think it works to have the judge appoint the intake officer. That works in my county. I have an intake officer. I have an intake unit made up of 3 or 4 people, including the prosecutor. And then, so what comes to me as far as the recommendation has passed through counselors and the prosecutor. And what comes to me is a recommendation.
That is the Cadillac. And you go to the smaller counties, which may be one you're talking about, and they're basically using the state agency as their intake, meaning DYS gets the report from law enforcement and they tell the judge, this is what we think we ought to do.
Or they're using their secretary in their law office,
Things like that.
if
But
it's a referee.
I
Yeah,
know there has
absolutely.
been talk about taking intake possibly out and maybe putting them under AOC or different state agency or a court type system. But the statute is set up because I am by statute responsible for the intake unit. I'm responsible for making sure that it happens. So I'm not sure I answered your question, but
No.
I agree.
No, you guys didn't. I guess it's difficult to answer because we're dealing in a hypothetical, and I know we're pressed for time, so we can talk about this later. But my question would be, under whatever system we go to, because intake is I think one of the larger problems that we have in this entire system. And I guess my question is, no matter what we do end up doing to youth court under each one of these scenarios, where would this intake person go? And I mean, I have some thoughts, like,
Love to
even
hear
an
'em.
extra deputy chancery clerk or something that's specifically assigned to this, because particularly like on some of the designs you have, like take Noxubee County, which is where I'm from. On the hybrid level, Noxubee County would cross over Lowndes County, Oktibbeha County, and we would be in a circuit or in a district with Webster, Chickasaw, and I think Clay counties. And so my question is there going to be one intake officer that's having to come from Chickasaw and Webster all the way to Noxubee, or do you still have the idea that each county needs someone who is specifically doing intake? And that's kind of where my mind is. No matter which system, where does this intake coordinator go? Because that's a key.
I think ultimately you need to look at the numbers, but ideally, I think you need to go with the premise that every county needs their own intake officer. They're dealing with local law enforcement, they're dealing with local CPS and local schools. There needs to be that county-specific intake officer to bring in all of that information and then know who to send it to.
Talk offline, but my only thing in a small county, they may have a small job. That's why I'm thinking like even an extra deputy clerk specifically assigned to that.
I
or
want to,
something like
I want to
that.
address, you were talking about a deputy clerk, that we have in the state of Mississippi made the world believe that, not the world, excuse me, the youth court and the legislative people believe that intake is a clerical job. It is not a clerical job. Intake includes a clerical person that presses a button and brings that case out of the cloud area into our MyKids system. But the true intake unit needs to be a qualified person with degrees and training that can say, okay, let's look at this investigation. They need to have CPS training? Did CPS do what they needed to do as far as their jobs, and as far as did they visit the right person? Were there contacts? Who did they go talk to? And then they need to be able to take that information and see if they come to the same conclusion as CPS. This is not a box that we're marking off, okay? Those intake workers need to be qualified professionals that then come to me and say, Judge, we've reviewed that report from CPS. We've reviewed that law enforcement report. This is the recommendation to you. I don't need a recommendation from a deputy clerk, and I don't mean that rude, but like, I don't need that. I need someone looking at this and really having been trained in social work and different things. And kudos to all the deputy clerks that are doing it, because I know that that is the only reason that we are functioning right now. But it is not the intent of the statute, and it is not what we need to do to protect children in the state of Mississippi or the community. And I don't live, but you are exactly correct. But that's why we're asking for more funds. At the end of the day, even if you don't change a structure, your county has got to have more funds to be able to have that intake unit and make all that stuff stop happening.
Senator Braun.
Somewhere in Senator Hickman's presentation, he said the words, "That's where my mind is." And I've been wondering, and now we know. I have a rant before I get to my question. And the rant is about counties, because that has a lot to do with this and a lot of other things. Take Union County, which I always use as an example. It's got a county seat, New Albany. It's got the New Albany trade territory, which generally speaking is Union County. And it's a big deal. The courthouse is a big deal. Folks know when court's in session, and they know the clerks and all of that. And that's the way counties are supposed to be. That was sort of what's in everybody's mind when they were setting up these counties way back when. But as time has gone by, counties are different. I mean, you've got Issaquena County, which has a shared chancery clerk and circuit clerk. And you have DeSoto County, and I won't guess how many people in the county know where the county seat is, but I guess it's a smaller number than in a lot of counties. There's no connection between suburban counties and populous counties and the more rural counties. And I also say that Mississippi is becoming more rural. You say, well, how can that be? Because everybody's flocking to the urban areas. They are, but they're leaving behind areas which are becoming more and more and more rural. The other thing that's happening is when a lot of stuff was set up, including all of this, the county consisted of some supervisors and a jail and some clerks, and that was about it. We didn't do all this stuff that counties do now. Theoretically, we did. The counties dealt with the mentally ill people in the county, but The only choice was to lock people up in jail, or when we got a state hospital, send them there. That was the beginning and end of it. The same way with children, we got to where we had a youth court and dealt with children outside of youth court, but there were limited facilities available, limited things you could do. You know, in the 1880s, there wasn't a lot of concern about the cost of facilities taking care of children with mental problems. And so what has happened is now we have more things, and this crops up in the area of mental health, in the funding of community mental health centers, in the funding of courts, and on and on and on. It's all well and good for us to sit here and say what ought to be happening, but when you get down to historically, this was a county responsibility. Therefore, it's still a county responsibility simply because we haven't changed anything. The smaller counties just don't have the money to do it. And that's going to be a chronic problem, and it's going to get worse. So one question in all of this, it's cropping up here, but it's cropping up in other areas, is initially, if you look at county courts and JP courts and circuit courts and on, one of the major differences is who's paying for all this. And so I just mentioned that as sort of a background, which I think we've got to come, if we're going to do anything, we've got to deal with that issue. The other question I was going to ask, or the question I was going to ask is, you've mentioned the responsibility of the youth court to go find placements and on and on and on. Why is that not the responsibility of CPS? Why is that not the responsibility of the community mental health centers? I don't know anything that excludes children from the responsibility of the community mental health centers. Why don't you just pick up the phone and call Region 3 and say, I'm giving you custody of this child, go find an appropriate placement?
They would be left on the street.
Excuse me?
They would be left on the street.
Why would your community mental health center leave them on the street?
Well, we don't give custody. We give custody to the state. We give custody to CPS. Now, I will say this. She made the comment about what all different judges do. Every judge is different. I don't look for placement. That is CPS's job. You know, I may call around if there's not a bed and beg different facilities that I have personal connections with. But, you know, the laws are set up that we give custody to CPS
Okay.
and they find placement.
Well, I'm not beating up on CPS, and I'm certainly not beating up on the community mental health centers or any of that. I'm simply saying that I think when you get down to the real world, we can assign and have assigned responsibility here, yonder, and there. But if in fact on the ground, there does not exist a place for an individual to go at reasonable cost, that's going to be a problem. And that doesn't matter if the individual is someone with a mental problem, if it's a child who's just plain dangerous or whatever it is. If there are not facilities that actually exist in the real world at reasonable cost, we're going to continue to have problems.
Amen.
Additional questions? Mayor Wiggins?
Where did you come from?
Live and in person.
Right.
Thank you, Madam Chair. Real quick, I want to say, and yes, I was listening to the testimony as I came in on two wheels. So thank you for the report. I haven't sunk my teeth into it yet, but I am pleasantly, not that you need my approval, but I think it's a very, very good start and is necessary. And so my question is, when you were testifying, I'm not sure who was saying it, but you were saying in the referee areas and then the, what I call the full-time youth court areas, you were mentioning how many kids were in custody. And as I've come to learn, bringing a child into custody in and of itself is a traumatic experience. And what we've done is, or what we've been trying to do is to prevent that. But when you were reading out those numbers, what it sounded to me like in the county, the courts with a full-time court, you had less kids in custody, but in the referee court, you had more kids. Am I saying that right?
you can't make a general statement, but it is true that we have referee courts that have way more kids in custody than some of our county courts.
I don't think either one of us are sitting here questioning the decision of that judge to bring that child into custody. We don't know what the reason was.
No, I'm not saying that. My question is, so it's a simple question of why. Why in the referee courts is it much more kids in custody than in the full-time youth courts?
Because you have some counties that have a huge meth problem that don't have a lot of population. You have counties that, my county is Lee County. I have a lot of kids in care, but do you know how many resources I have? I can't imagine if I didn't have the resources, what my numbers would look like.
I did think
Too.
also, without studying the individual court to know, I think one hypothesis is that frequent hearings help kids get home sooner. Now, if you're only reviewing that child's case once every 6 months, then they're going to stay in custody longer and you're going to get this buildup. But if you're seeing them every 60 days or every 120 days, then you're more likely to either put a fire under the parents to do what they need to do or put a fire under CPS to do what they need to do. So frequent hearings help, but at the same time, if a full-time judge can do more frequent hearings.
Okay, and so I think you're answering my question, which is if you have a full-time court, then you have at least a structure in place that provides you of some kind the resources that are probably not there right now. Is that a fair statement?
It's fair, but I wouldn't say that the counties like Lee, Harrison, Jackson that have large numbers in custody, they have large numbers in custody because they're large counties. But the smaller counties that have large numbers in custodies, I think that is a fair statement, I think.
Okay, that's what I was saying. And in the smaller counties, generally speaking, are your referee system. Is that correct? Which I would argue is probably not fair to the children. That because they live in a rural county, let's say, they're not getting the same resources or services through a youth court system that the kids in Harrison County are.
One thing that everybody on the commission agreed to is every child needs access to a full-time judge.
Yeah, I saw that, which I think is tremendously, I'll put it this way. I don't think that was the understanding when that commission was set up and y'all came out and did your work and that's the recommendation.
It wasn't.
It wasn't.
And I think that's tremendous because just where I sit, y'all looked at that. And so that leads me to my next question, which is just hearing, seeing your report and all that, there's a lot of issues here. And I'm generalizing here, but why did we get here? Or how did we get to this point?
If you
And if you
don't,
need to point fingers at the legislature, I say go ahead and do it.
whatever this body or this state does not deal with today becomes a problem tomorrow. I wasn't alive when this started. You weren't alive when this started. You weren't a senator when this started, but we all have the responsibility of owning it now. It's kind of like what you said, we have to own it now. Because if we cannot divert some of these children that are in my court system from, we call it going downstairs to the second floor to felony court, you cannot appropriate enough money to build enough jails to house these children. It's the long and short of it. So you can decide where the money goes. And we really didn't get into a lot of money because we don't handle the money. But I'm just going to put my taxpayer hat on. If we don't invest in some of these things now, you can't control them in the future. And we are suffering right now, I believe, and this is from not doing that, but it's a lifetime of it. You know, I'm not looking at Bryce Wiggins saying you didn't do. We're talking about years of not investing in our families.
Kids are different. In the 80s, probably the youth court judges had kids who were trespassing and shoplifting and
Right.
rolling houses and things.
And
that-
true orphans.
And orphans and now the youth courts are dealing with burglary and weapons and meth and drugs and addiction
Fentanyl.
and mental health problems. So we have a system that was designed when the times were different. And we need a system that is for this decade and this century, basically, because we're dealing with, if you look at the headlines, it's not adults that are killing people. It's teenagers.
It's 19, 20-year-olds.
And we have an opportunity. In my court, I've created a GED program because when kids drop out of school, and I have a drug court and we do life skills. Only a handful of judges are even hearing truancy cases because you don't have time for it. So the money you're investing in education, which is huge, a part of the budget, it's not going to, I mean, for a big segment of the population of our children, they're not going to school. The ones that we deal with are not finishing school. And so we need youth courts that can handle truancy and all of these things. And the county courts, I'm biased, I'll say it up front, we have the time to do that. And we are where law meets equity and public safety meets compassion, and all of those things are in county court. But Chancery could do it too, but that's not
I
what I
think
am.
that's an important point about our system, youth court system is not kept up to date with what.
It's antiquated.
Okay, thank you. Okay.
It is, and it's the same way. I was talking to a chancery judge attorney when the Supreme Court set out percentages for people to pay for child support. They never thought that somebody would have 4 different children with 4 different parents. It didn't work that way. And now we're dealing with having to apply these different things that it just didn't work
And you're
that
from
way.
a 80% marriage rate down to a 50% marriage
Right.
rate,
And-
if not less.
And so our whole society, our laws have got to change with what is going on, so we can deal with it. I just don't want to see the state to continue to be, well, that's the way it was. You know, this group of people had lots of hard conversations because we're human and we love what we do, but we also know there were lots of referees on here. There were lots of county court judges. There were lots of people that stand that our own way of life could possibly be changed as I'm sitting here next time. But we all came to the point that on this commission that the kids are worth it. The future that my child is going to live in and your grandchild are going to do, it's worth whatever we have to do at this point.
I want to thank y'all so much, and I want to thank your entire commission for what you've done, and we appreciate it. And I know you'll be presenting to different committees before, but some of the things that you just said are some of them I think have the most wisdom for this body, these last concluding remarks. So thank y'all very much, and we look forward to hearing from you much more and helping work to solve this issue. Thank you.
Thank you.
And we'll be back in at 1 o'clock. Commissioner, if you want to go ahead and come up, we're going to go ahead and get started. And I think a couple of people had to take phone calls, but they will all be coming back in. Thank you. And Commissioner, we went through this morning and you may have been listening, a number of the legislation, we just kind of briefly drilled through for the committee as a reminder. A great deal of work that your office has done since the last 2 years that we've met, and a lot of the legislative changes that were made, and just kind of what the statutory changes were that we did in the legislation. And then we look forward to talking about everything this afternoon. So thank you very much. We appreciate it. Okay, he's going to get you in just a second.
You'd like to think I could have just done that, right? I've learned not to touch mics too much. So thank you both all for this opportunity. And, I know we're here to talk about creating better outcomes in Mississippi for families and children, basically. And I'd like to say first that this method you've taken to approach this, holding hearings, gathering evidence, even asking for experts, in my opinion, that's the way we get to good policy that's consolidated and consistent that creates better outcomes. I really appreciate the candor you've asked for. You did send me a pretty long list of things that you'd like to discuss. I only have 2 hours, and so I want to run through and hit some of those quickly, and then I really appreciate you allowing me to bring in an expert who will talk to you about the trauma of removal and a little about some of the challenges that child welfare faces across the country, as well as I hope she'll also speak a little bit to how Mississippi looks compared to other systems. She has worked in Mississippi for a number of years. So I look forward to getting her up here. First, I just want to reiterate that we have seen a steady rise in the number of children coming into custody since June of 2023. It's aberrant from typical trends in terms of that it has been a steady increase, and it has outpaced the number of children leaving custody. So that's alarming. We have between 500 and 550 more kids in the system than we did a year ago. The increases, we're still kind of trying to get a handle on why. I know that we've had a lot being driven by substance abuse by parents. And I have seen some changes in policies in jurisdictions, particularly rural jurisdictions, that are testing all parents that come into the court, regardless of the allegation. And often we're asked to pay for that. So that's how I know about that practice. But nonetheless, we're taking a lot of kids. There's disparity in the opinions, that there's personal preference that really pervades each court system. And I think that's due to a lack of a uniform court system and lack of following the formality of court. You've been told for many years that youth court is special. I would argue that the subject matter of youth court is very special. But the court itself, we have safeguards built into the court system, checks and balances, ways to appeal decisions or object to decisions. And I think they're really important. And that's why I've advocated with you to have the right lawyers in the room and the right parties represented so that we start to build a record of what's happening in youth court. I'll talk to you a little bit about trends in that regard. I will say, in terms of kids coming into custody, you're going to hear today that bringing children into custody does not make every child safer. And in fact, it should be a last resort for the state with other measures taken if possible. And you'll hear more about that from Melissa as well as from me. There is as an example, on the coast right now, there's a strong political push, and it's being fueled by testimony in a committee in Harrison County. And I suspect that they will present proposed legislation to you. But there's a mindset that if we don't take enough children into custody, that means that those children are unsafe in their own homes. And I would argue that that's not based on evidence, and it's not based on the outcomes that we see with children who are taken into custody and then come out the back end of the system. So it causes tremendous trauma to kids to be taken into custody. And then I'll also talk to you about overuse of the system and what that does to the real mission of the agency. If it becomes the default deliverer of services for everything that plagues children and families in Mississippi, then we start to miss our actual purpose. Our mission is to protect children in a very unique circumstance, in the confines of their own home, in their sacred space, from the people who are supposed to take care of them. And when we become a solution for bad or insufficient parenting, we end up missing our original mission. And that is that about 15% of the kids that we see in this state are being burned by cigarettes, being sexually abused by an adult who's supposed to take care of them or protect them, being kept in a cage in a closet and starved, being made to run around their house for hours in the sun. So we can't lose focus on those kids. They need to be removed from their home quickly and expediently. So I'm going to lay out for you why I think it's really important that we align the services in the state that are designed to strengthen families, which I believe is the best way for us to keep children safe in their homes. Taking them out of their home is pretty severe. I liken it to amputating a foot. Once you amputate that foot, you can't ever put it back on right. And sometimes the foot has to be amputated. If the kid comes in or a person comes into the ER and their foot is black and oozing and infection is running up their body, we got to take that foot. And we're happy we did it. But if they come in with a splinter or a busted toe, we need to take other measures first. So the solution, custody as a solution in Mississippi is becoming, or may have always been, I really don't know the history, but we've become a de facto insurer of children who don't have adequate coverage for the care that they need. We've become the de facto placement in delinquency matters where there is no disposition for those children or not one that's readily available. I will tell you that delinquency matters are housed, the youth court hears both delinquency, juvenile justice, and dependency matters, which are abuse and neglect matters that come to CPS. DHS still houses the Division of Youth Services, which is the state's arm to manage cases in the youth court in the delinquency side. The DYS counselors currently in 2/3 of the court are the intake officers for the court. And those youth often get directed to CPS for taking responsibility for the child, its placement, their placement, their treatment. I'm gonna give you a couple of examples very quickly. 2 weeks ago, there was a youth in a delinquency hearing with allegations that he assaulted his aunt, sexually abused his sister in his own home, so he couldn't reside there. The court placed him in CPS custody rather than detention and ordered us to find treatment. or placement. As a practical matter, the agency doesn't have beds. We are not a placement. And this myth that somehow we're a disposition ends up really prompting a lot of overuse of the system. But when I go take a kid, I have to contract for a bed for that child, often in the middle of the night. I can't keep them in my office because of standards in the Olivia Wilde lawsuit and national standards. But that leaves us with much worse alternatives. Driving around in a young person's car with a kid who's just been kicked out of a facility because they've disrupted it and law enforcement can't transport them cannot possibly be a better solution. In May, had an adolescent who was in DYS, in the delinquency side of the court, in a sex offender program, got discharged because of behavioral problems, was rejected by 3 additional programs, placed in juvenile detention, discharged to father, pulled a knife on dad, brought back to DYS custody due to violent threats. In the delinquency hearing, placed in CPS custody upon recommendation of the DYS worker. CPS wasn't even present at the hearing. When I asked for examples like this from my staff, I was inundated. We're interacting with youth who have complex mental health issues, and they manifest as behavioral misconduct. And there's a trend in this state, and I think probably everywhere. These are tough kids to deal with. So I'm not, trying to disparage anyone who's trying to come up with solutions for these children, but I often hear from mental health facilities, they don't belong here because that's behavioral. They're choosing to do that. I've been a licensed master's level social worker for over 30 years. And as a clinician, unless something's drastically changed in the field, children and adolescents manifest their mental health issues through behavior. So I don't buy that excuse. They act it out. They don't often sit down and look at you and say, I'm feeling very overwhelmed today and quite depressed. So, trying to make sure I don't duplicate myself here and get to Melissa quickly. I would encourage you to remember that legally, our role is to both investigate abuse and neglect in the home from parents. That's why we send social workers in there and not law enforcement. So it's a narrow niche and a delicate matter. We're really invasive and we're looking around in people's homes and asking questions in their community about their parenting. We stand in the shoes of parents and we consume the services the state has to offer. So as this committee considers what the state has and what the state doesn't have and how those services align with each other or don't, we're one of your best data pools. I have 4,100 kids in custody today, and we are a consumer of the services the state has to offer. We try to provide some services on the budget that you give us, but in the end, if we build out a system of care in the state that's only available to foster kids, we will only continue to see the number of kids in custody skyrocket. And that is building its own mental health crisis. I'm going to quickly hit on some of the questions you specifically asked me to address. The replacement of our old MACWA system, the case management system, which is one of the systemic reforms that will have lasting impacts for the next 20 years. So investing in technology, I think, is a really good move on the part of the state, and I thank you for that. That project is underway. It's had 2 delays due to contractual disputes with the vendor. We've stood our ground and insisted that they deliver what they proposed to deliver, and right now we're on budget. We've had two delays so far with evidence. I'm just not willing to commit to a date at this point, but right now we're at May of 2025. And so far I need my capital expenses reappropriated. I'm guessing that I may end up needing some extra appropriated this year. We asked for 3 million. All of that money is being matched 50-50 with federal monies. So it's a good investment. The split from DHS, it is mostly completed. We have one federal grant left to move, and we rely on DHS for the back end of MACWIS, the old case management system that has to keep working until we get CWIS completed. It's in its death throes, and it gets sluggish. It shuts down on us. We lose data when that happens, documentation of children's lives. So we're trying to work with DHS to replicate the back end of that system and pull it out of their larger grouping, because it's receiving the strain of the use of all the systems. And we've had good cooperation from DHS on trying to get that done. Olivia Y., the 20-year-old lawsuit. We had a meeting yesterday afternoon with the plaintiffs. We've been in negotiations over the next phase of the lawsuit. We've been in an agreed order to set aside the second MSA and all of its metrics in lieu of a more consolidated systemic approach to improving the system. That expired August 31st. We've actually just confirmed with the plaintiff. Can I tell this? Well, we're not going back into the second MSA immediately. We will have, between now and the spring, we'll be working on strategy for how Mississippi can exit that suit. And so I'll have more to share with you soon. That's my lawyer in the lawsuit. Sure, lawyer in the lawsuit, I should say. Impact of the legislation you passed last year. The legislation that came out of the adoption and foster care task force, that was, to me, one of the best examples of government working well. You again gathered lots of evidence, you considered lots of positions, and we put together a package that should have meaningful impact in the courts. As far as how that's impacting service delivery right now, I don't think it is. And there were numerous provisions. There was a change of the neglect definition. There was, you clarified that children have to have a voice in these proceedings. And if their wishes, especially in their teen years, conflict with what the GAL says in their best interests, then they must be given a lawyer to represent their interest. That's happening very sporadically across the state. And I would argue that that's because we don't have the right lawyers in the courtroom yet to ensure that that happens. I've seen zero impact from the change of neglect definition. And in fact, our numbers have only escalated, as I mentioned before. Oh, yes, sorry. Yeah, absolutely.
Since you're mentioning the numbers, and I was looking at your chart, number of children in custody, which I think is what you're referring to. And it looks like in July of 2024 is when there became a big spike. And you just said about the law, what's going on? Do you know why this is the case, or what are y'all seeing on the ground?
A lot of removals due to substance abuse by parents and lack of treatment opportunities for those parents. We have a lot of homelessness in the state that's impacting removals without solutions for the homelessness. Potentially very good parents, people who were good parents, but they don't have secure housing. And so we're resolving that issue by putting them in custody. And I've shown y'all how much that cost. So that's the number 2 reason we remove kids in the state. And then there's a lot of disparity going on in the decisions to remove children across the state in different jurisdictions. There's no consistency. And frankly, I think there's a fair amount of unrest based on the push for reform in the judicial system. And I think that I'm bearing the brunt of some of that.
Meaning
More kids coming into custody.
as a retribution or something?
I'd probably like to have that conversation off record.
Or I'll say it this way, so because whomever it is mad at CPS, they decide we're just gonna go put them in CPS and let y'all deal with them?
Well, I would refer you back to earlier, the conversation about the Committee on the Coast that's hosting people to come in and give their opinion on CPS and its practices.
That's in Harrison County is?
Yes, sir.
Okay.
A prosecutor stood up and talked in the meeting before last and outright said, the problem is at the top. It's been happening for the last few years. I used to have 140 kids in custody in my county, and now I only have 70. That tells me, and he said this unequivocally, that I have over 70 families who are unsafe, children who are unsafe in their homes today. So there's a mentality that taking children equates safety. And I think that we all have to educate the public and the people who make life-changing decisions on behalf of children, what the evidence actually tells us. That is based on one person's opinion and not a lot of evidence-based training. So I think that there's some coordinated pushback in counties who think that I've ruined the system by trying to reduce the number of kids in custody. As you can see, I've clearly failed at that so far, but it's a difference in philosophy. And, you know, that's one reason I wanted to bring in an expert. And I encourage you to look at evidence and listen to experts, because Mississippi's due for an overhaul. What we're doing is not creating better outcomes for kids. And I think that's one thing we can all agree on when you look at data.
Can I follow up with just, as we're talking this, because I was going to ask this question, is you had just mentioned before we started asking a question, and that is we're not seeing a difference between abuse. We're not seeing the number of cases coming in when we've changed this definition of abuse and neglect, and we were trying to bifurcate those two important issues. Is that a training issue, or that we need to do more training and better training for all of our judicial staff? And maybe even, I mean, even with the Board of Supervisors in those counties, do you know what I'm saying? With that whole system in place, or do you think it's a resource issue? Because I don't have the resources in my area to help them with housing. Like my county has a really good network when people fall through on housing issues, but other counties don't. So, do we think it's a resource issue, or do we think it's an education issue, or just a combination of all?
I think it's both.
Okay.
You have an intake officer and a judge who means very well. People aren't in this business because they don't care about children. But people are also not lukewarm on this subject. And every single one of us brings our own childhood, our own personal beliefs to the table, and what mood we're in that day. And that's why I think it's essential, especially because of this special subject matter, that we use the court process get all the evidence on the table and have a transparent process that's kept confidential, but that's subject to appeal and, or that's appealable because we have records and we have the right attorneys in the courtroom. And I think that we owe it to our kids to use evidence and use data. Don't listen to Andrea. I'm not an expert, and sometimes I'm in a bad mood. So, but we've got to start listening to what evidence and science tell us about what is actually happening to these kids. And if you would like, at some point, I would love to bring in kids who've grown up in the system and come out of the system. Not that I handpick, but just let you hear from that population. Are there any other questions on that? You did fund last year a project, a public-private partnership with Canopy Children's Services. They were the agency that Wendy Bailey and I recommended together because, and only because, they're a nonprofit. They don't stand to profit from this investment, and they are a statewide agency that had the capacity at the moment in time. They have a CON for empty beds, and they have beds, and they have land. So they are building what I perceive as a missing level of care in Mississippi's mental health system, and that is a subacute, I call it subacute, something between acute, which is a very short-term, quick stay. I don't know that it has that much value to children and adolescents whose issues are really formed in their family and formed by the experiences that they endure. So this will add a level of inpatient care that is long-term, but very intensive and designed for kids who've lived through multiple traumas. It takes 3 months to start even building some attachment with kids like that. But the outcomes in places that do a good job with this are quite excellent. We send kids right across the border in Memphis to youth villages, and many of those kids do not come back into my custody in a state of crisis where I'm just picking up and trying to figure out what to do with them again next. So thank you for that funding. I believe Wendy's bringing an update tomorrow on the status of that project. It's caught up in some MOU process. You asked me about federal grants and funding, how we can maximize those better. And so I'll address that in your other question about legislative assistance needed. I've already hit on why I think it's really important to have a uniform youth court. And I don't personally care if you call it a green court or a chancery court or a county court. It's important that they be elected specifically for that purpose. It's important that they have specialized training for that purpose. It's important that they only serve that purpose. And it's also essential for economic reasons that they serve more than one county in jurisdictions where the volume doesn't warrant a full-time court. So I am unabashedly telling you that I think that that has to happen in Mississippi for us to genuinely see consistent and better outcomes. Juvenile justice reform, somehow we have to quit blending the two. And I would argue that, I know Mr. Anderson has advocated for adolescent offender programs. Wendy Bailey has adolescent offender programs. We need more of them, but we need to align them in a way that we're not duplicating efforts. I don't care who owns it, but diverting kids from delinquency matters, and it has to happen early. We're getting kids at 12, 13 years old, and they're packing heat in this county because they have to. That's a survival mechanism, and it's actually a rational decision. I think that there needs to be procurement reform, or at least in regard to how my agency functions. I am trying to buy beds for children, an unknown quantity of children. And I have to go through all of the usual procurement processes to try to get vendors who can recruit and retain foster homes. So I've had to exercise my authority to use emergency contracts based on the number of children that are coming into custody. And I can do that, but it leaves me kind of hanging out there. I'm declaring that there's an emergency, and then I have to defend that to the board. So really considering, if we're meeting the needs of children in our custody as their parent would, it's not the same as buying bales of hay. So just food for thought. I think that licensure is low-hanging fruit in the state. Licensure of facilities. We have it in multiple locations. And I will tell you that your human service agency directors, we've formed a strong bond. We have a good relationship. We meet on a regular basis, albeit at Primo's over breakfast and coffee, but that's where the best relationships are made. And it's where we start to let down our guard, stop guarding our turf, and talk about possibilities. Licensing of facilities. If you want to be a new mental health facility, you got to go get a CON from Dr. Edney. You got to get licensed by Dr. Edney, but he's only looking at whether or not you have enough fire extinguishers in the right place. And then you got to get certified by Wendy, Ms. Bailey, Director Bailey. And we all agree that's nonsense. There's no accountability anywhere for all the things that are necessary to ensure quality for children. And it's an arduous process for the people trying to deliver the services. 3 different kinds of people are coming in to check what they're doing. Of course, I believe that we have to be funded to have attorneys in court. I just don't think we can get the outcomes for kids that we need until we're represented and we're recognized as a represented party. And we're not receiving directives directly from the court through text. And I'm going to give you one more anecdote, and I hope it chills you like it did me. But I had a court have their sheriff detain 2 of my employees on a Friday afternoon and send me a message that they would be detained until I called. She was mad. They didn't do what she wanted them to do. There was no order. There was no hearing. And in the end, the state of Mississippi is responsible for how it treats its employees. And I will just lay that out to you as an area of exposure. And we got to follow the rules and the law. And holding state employees in criminal contempt, and actually more often in civil contempt, but hitting their pocketbook, making them pay the court $50 when the court's displeased with how they conducted themselves. With the amount that we pay those people, it's a wonder that we keep any employees. So I would advocate for a different method of holding employees accountable. I think that that's my job. Very quickly, some places to start on legislative reform, because we're talking about an elephant here. Where do we take the first bite? What I would do is first identify all the state funds that are unmatched, as you've asked me to do. I spend about $20 million on healthcare that's not matched. It's unmet medical needs, sending kids out of state where the managed care company won't negotiate for a special rate, and on putting kids in hotels with sitters. Wholly unacceptable solution. Other agencies have similar, some agencies have more, some agencies have less. Let's put it out on the table and talk about it. Talk about where it comes from. Let's identify the federal funding stream. So one of the documents you have in front of you is the product of work done by the State Early Childhood Advisory Council. I'm the executive director of that council. It serves at the pleasure of the governor, but it's designed to bring together information about what's going on with children in the state. And the first thing we did when I got into that role was we embarked on an asset map. And that is the first 8 pages. You'll see that the asset map on the back, it's designed to track what comes into the state and where it goes. It's pretty it's kind of a tangled mess. It's like a ball of spaghetti. But that work has been done, and the full report is lengthy, but it's available on www.msccac.org under resources. I would hold meetings or identify a task force of agency heads that deliver human resources, human services programs. Dr. Edney and I joke all the time, we need to sit around a table and play Go Fish. You have these programs that are serving mothers who are in this state of their pregnancy. I have these programs. Let's consolidate them and align the funding in a way that we start to leverage them in concert. And, I'm not interested in more to do, and neither is anyone else who has an agency, but shifting things in a way that makes sense and aligning similar programs and similar funding streams is a place to start. And I would ask agency heads how they see that best working. I think that we're at a place right now in time where that could happen. I've hit the highlights of what you wanted to hear. I think it's really important for you to hear from Melissa Carter now. She came from Atlanta to be with us today. She's here in her personal capacity, but she'll tell you her background and her expertise. She works as a consultant for the agency in some matters. And so unless you have questions about what I've said,
I want to ask you really quickly, because you brought this up at Elbow, that I think it's kind of or I asked you the question, I believe. So we asked you to bring it up. There was 2 different sources of money. And I know one of those is that we ask you to look at and you mentioned this kind of briefly and broadly, but I want to get specifics on this. There is approximately 15 to 20 million that we're spending pure state dollars on, from my understanding, that we could be getting some Medicaid match dollars on. Is that something?
I think that's a strong potential. Yes. It's all money being spent on health or mental health services for children. And it wouldn't cost us additional money as a state. I can certify my dollars to draw down that matching money without it increasing Medicaid's budget.
Senator Parker brought up last week, I believe, at Elbow too, and correct me if I'm misstating this, but one of the things too that he asked a question about, and I believe somebody in the House followed up too as well with this, is that there are TANF dollars right now that you could be using in your agency to really look at preventing children from going into the system, and being able to align the agencies to where we are working on those goals together would be a great, it would be a great help to the state. Is that?
Yes, yes. One of the primary tenets of TANF is to keep families stable and to keep children safely in their own homes, to prevent removing children. So if you wanted to get really granular as a state and looking at data, one of the best metrics that I think the state could look to see whether or not what we're investing in to stabilize families has efficacy is to look at, are we able to safely reduce the number of children? And that means reduce the number of children and prevent reentries into foster care. So it's not just, are we going to just kick kids out of foster care? It's, did we do it safely? TANF is a block grant. It comes down in a limited, each year we used to get roughly 80 million. I suspect that's still the same. TANF has the potential to really invest in those families on the front end. It's what it was designed for, to prevent removal of children unnecessarily. It also can be converted to a couple of different funding streams. A portion of it can be converted to SSBG, which is an even more flexible method of spending TANF dollars. And then a portion of it percentage of it can be converted to childcare block grant. It takes on the identity of that funding, and DHS may be doing that now. I know that they've talked about it, but childcare is a critical issue for keeping families stable. And it's a critical tool for preventing removal of children. When families can go to work and when they have housing, they have a much better shot at keeping their kids and the state not having to intervene in the way that we do.
We'll be looking at that in November. This committee will be, so particularly at childcare.
The two uncapped funding streams that you have, well, one you don't have yet. One is Medicaid, it's uncapped, and it's only limited by how we've defined that we're going to spend it and the state having the matching portion. But our federal match is so healthy in that program. It is one of the highest in the country. So fluctuates, but between 75 and 80% for, you take a quarter, you make $1. The same thing will be true of FFPSA, and the agency has, this is a child welfare funding stream through 4E. Melissa has been one of the things she's doing for us is helping us submit a plan. We're about to submit for the third time. This is a typical back and forth process with the feds. But when we have that funding and it's flowing robustly, in 2027, the funding will move to the FMAP match rate. Until then, it will be at a 50-50 match. But that's another opportunity to sit down and ask other agencies, county funds, what are you spending on stabilizing families that might qualify to draw down the FFPSA? There are limitations. It has to be, you have to have evidence-based programs. There's that are supported by data, and there's pretty rigorous reporting requirement, but it does ask us to up the ante and really deliver good quality services to children, not just try to help somebody. That's noble, but that's what churches should be doing. If we're going to pay for service delivery, we need to deliver services that have a good high chance of making a difference in that family. So I'm going to ask Melissa to come up now. I'm sorry, does anyone else have a question? Did I answer what you have? Because she's from Atlanta, I'd like for her to have most of the time, and I will always come back and talk to you or talk to any of you individually if there's not time left over today. If there is, I have a couple of points I want to make.
As long as she's not a Falcons fan, that's all.
As long as what?
As long as she's not a Falcons fan.
Okay, not,
Okay, good.
not. She swears. I realized I never started the. That's what I want to talk. Do you have our PowerPoint? Is this my thing? There. You're up.
Good afternoon. I'm from the Midwest originally, and so I haven't really adopted the teams here in the South, although the South has been my home for 2.5 decades now. I guess we're always from where we're from. So good afternoon, everyone. It's so nice to be here with all of you, and it's such a privilege to be asked to join this conversation, and I hope I can be helpful to all of you. So my name is Melissa Carter. I'm a clinical law professor at Emory, where I run the Barton Child Law and Policy Center, which is a multidisciplinary child law program. We're training up the next generation of lawyers and social workers and some physicians along the way to work in this child advocacy space. We're also providing legal services to kids in courts. We also take appeals. And my work is to administer the center, but also to direct our policy and legislative advocacy work. So that systems change strategy that will complement all of that ground direct level work as well. And that's really been where I've spent really all of my career as a lawyer. And before that, I was a caseworker briefly, and I bring forward all those experiences too. So that work has allowed me to work in other states. And I probably just want to start by saying that the problems are very similar across states, but the solutions have to be local to your context. So I hope what I've done here is select a few things that allow you to be able to think more deeply about these complex problems, but I'm here to have whatever conversation you want to have so that we can solve for your curiosities and support you in your problem solving. But on this issue of the well-being of children in Mississippi's foster care system, thinking really about mental health as a framework for considering all of these aspects of our system design and the outcomes that we're getting. I mean, I think it's easy enough to start where, like, the American Academy of Pediatrics says that mental health and behavioral health are the largest unmet need for children in foster care. And I think, again, that's true here. It's true really in every state that I'm aware of. And as Commissioner Sanders started, I would start too with just not just as a process starting point, but just as really the place where mental health really has a kind of strong grip on children and the trajectory that we put them on. And that is with that decision for removal. There's a really growing body of research around removal. We don't have time really to go into any depth. I'm happy to follow up with whatever interests you, but provided a few slides here that I hope just in the end just kind of summarize what that body of research shows us, which, as you can see here, and as you can easily imagine, the separation of a child from their parents, even when it's necessary, is life-altering. That's a radical reconfiguration of their identity, their sense of belonging. It displaces everything that's familiar to them, and is disorienting and experienced as a really profound rejection or loss. And the literature here talks about not just grief and loss in the way that we all experience it when we lose someone that we love, but in this new category of ambiguous loss, the idea that you've lost something and you know it's still out there, but you don't know how to find out anything about it, and the level of anxiety that that creates for children in particular, not knowing where their parents are or their siblings are, and whether they caused all of this or what's going to happen with them. That level of uncertainty, again, changes us. And in fact, Dr. Charles Nelson, who's a pediatric neurologist at Harvard, has really just put it this way, which is the effect is so catastrophic that if we actually followed the research, we would never do this. And of course, we have our own justification for why we do this, but it's that level of profound impact that we carry in making the decisions to remove children. And I think that's where we really need to consider how judicious we are in making that decision and exercising that power. This is a little bit of data, if you're data people, to really start to position Mississippi and the experience here in a national context at one level before we return back to the state itself. As you know, there's a lot of data collection that happens in this field. It's really, though, only been a self-evaluating system for a couple of decades. We started collecting data on outcomes and process in child welfare in just the early 2000s. And so it really is, we still have an appetite for collecting information. We're still learning how to use that information to manage our systems and to drive change in the direction that we want it. So this shows you and positions for you where Mississippi sits compared to all states on the average monthly removal rate. And as you can see, we sit really at that kind of national average. So the national average is 2.1 per 10,000 children removed each month. Mississippi is about 2.6 based on this data. The most recent submissions, as the commissioner said, start to show a little bit of an uptick. But it gives you a sense that really, in terms of removal, the front end of your system is at least arguably by national standards kind of right-sized. We'll talk about where some of the problems exist. This gives you a sense, though, of the variation. You saw variation across states in the country. You see variations here in terms of the counties and their rates of removal within the state of Mississippi. And you see then considerable variation. Again, this is not unique to Mississippi. You find similar variation in all states, interstate. Here, though, a child living in Noxubee County is nearly 11 times as likely to be removed to foster care as a child living in Tate County. And it's really those questions. There's a place in this work for community standards, and local resources drive a lot of what communities expect of families and what they can do for them and influence that safety decision around removal. And at the same time, the idea that, as we'll continue to talk about, we're operating here in a foundation of constitutional rights for the parents, I would argue for the children, certainly a grave responsibility and duty by the state. And so there shouldn't maybe be this much variation when we think that geography shouldn't dictate how then those rights and privileges and powers are exercised and experienced. That variation, it really comes down to what you think it comes down to, which is professional judgment. So there are all kinds of studies about decision making. It tells you what you know to be true in your own experience, that we can all in this room have a set of facts that we put up here, and we would all be able to say, we can describe those facts in a similar way, these kind of case characteristics, And many of us, if not all of us, would make a different decision about what to do in response to that same very clear problem statement or problem identification. So it really is about that professional judgment, which really immediately my work in Georgia and in every state, it's the hard work here, but what's absolutely critical is to make sure that our systems are designed to be competent in the way that they function, that we have the capacity within the systems to do what they need to do. And part of that is making sure that our workers, the people who are actually making this decision, have the tools they need to make the best decisions they can under these conditions which are anything but conditions that support good, confident decision-making, right? The time pressures are high, the stakes are high, there is incomplete information, imperfect conditions for making those very critical decisions about when children should be removed. But that decision, again, puts that child, I would argue that family, really on a whole different trajectory for their own well-being that we're responsible for. When children, of course, have to be removed, they enter foster care. Foster care too, even though as we think about it, we think about that as having the greatest amount of state control over that child and what's happening to them. That makes us think that we are ensuring their safety. That is our obligation morally and legally. But the truth is we are still working harm. That placement in foster care doesn't all of a sudden cure all of that harm of removal and give the child the sense of stability and security and belonging that we have displaced with that earlier decision. Instead, it really does promote just this ongoing sense of ambiguity, right? You have the continuing separation of that child from their family. And I mean, all of their family, parents, siblings, grandparents, fictive kin, the people they hang out with in the neighborhood, displacement from school and interruption of those attachments with peers, ongoing sense of loss of routine and everything that's familiar. And so continued harm, all of that can exacerbate existing mental health conditions and obviously can reintroduce trauma or re-traumatize children even more. So again, it's really just to really make the impression, leave the impression that we have this awesome power to exercise and we have a compelling interest in doing so. But doing that means that we have to weigh this consequence, these implications for the families that we're intervening with. And so we have to get it as close to right as we can. That variation that we looked at before suggests here, as it does everywhere in the country, that we're not really good at being precise and really discerning safety and intervening in those very targeted ways with those families that we need to. And so that means put it another way, it's a little bit arbitrary. And that arbitrariness works harm. This is your foster care sort of trend line over time, really from when the data started to be collected with any integrity around, again, early 2000s here and across the country to current by quarter. Based on this data, which again is about a year now, retrospectively, the total at the time was 3,610 children that the state of Mississippi is responsible for ensuring safety and permanency and well-being. And as you heard, my understanding is that number has now ticked up a bit. These lines, of course, we do this in every state that we have data for, and this is all based on the federal data that the states submit. And it all tells a story, right? And that's the story that's unique to Mississippi. Every state has this kind of volatility. And each one of those peaks and valleys is usually explained by something that's going on at the state level in terms of a policy choice, a resource investment, something that's driving that kind of change. You see this precipitous increase and then decline, and it's really almost on the order of like 50%. And those bars across the bottom, we won't go into it in any level of detail, but what I can tell you in conclusion about that is that Mississippi was really successful at safely reducing its foster care population. That whatever drove the bloating of your system, the overwhelming of your system, and there are lots of factors that we can theorize did that, there was this controlled decline. And that's really important. And then you've kind of stabilized, and again, with a slight uptick, but at this point, I wouldn't say that's statistically that notable. And so just looking at this and understanding what it took to make these intentional decisions that actually drive you to an outcome that you may say you desire, right? This is more right-sized for the resources, for the capacity, for the functioning, and for the outcomes that the system is getting for those children. If you're wondering, so I'm really describing that black thick line at the top, that's the overall number, this kind of EKG looking lines, the red and blue ones. The blue dashed line are children exiting foster care. The red are children entering. So you can appreciate that just on the simple math, if you have more children entering than exiting, then your overall number is going to go up. So that's kind of the hydraulics, the basic hydraulics of the system. So when we think about then, again, that ongoing harm that we talked about, the ongoing separation, the responsibility we have and too often fail to really meet the needs of those children, that's true for about 4,000 children in Mississippi on any given day. This is a different metric, not one that the federal government yet collects, but one that we've been working with in my center and done some work. This is actually from a national report that uses this metric around family separation. So just to get you, I think the commissioner, in my experience here with her and her team, really committed to really thinking about and driving decisions based on the kind of moments of impact. If we're intervening with a family, if we're removing a child, what is the experience of that child at each of those kind of intercept points of decision-making that we are taking from them or making for them? Family separation gets us a little bit closer to that reality. The idea of, for those 4,000-ish children in Mississippi's foster care system, how many days are they spending away from family? And that means family including relatives. So this is about children who are in foster placements, stranger foster placements, under unrelated group homes, et cetera. And for at least that same data, the same period that I've used in all of these slides, so we're talking about, again, 3,600 children in those slides, that comes to 732,745 days that those children have been away from family. And that is really the reason for the profound mental health impacts that this system has. It's easy enough at one level to imagine your own separation from your family, that being something that's done involuntarily, forced upon you, that you're not involved in that decision, you've lost total control and you're not given any information, is what perpetuates a lot of that mental health results. Part of what we start to think about is, then what do we do? What are we now responsible for children in foster care? We're responsible for making sure they exit timely to a permanent outcome. You're familiar with this. This is your permanency data for that same, actually a little bit more dated period of time. Just to give you, again, a conversation, it's kind of an input for conversation. I'm sure the commissioner can provide you with more current information. Permanence is one of those areas that we struggle with here in Mississippi. So again, if I said your rates of removal suggest that you're kind of on par, at least with the national rate, as a relative consideration, your permanence is a little bit more out of whack. And that means really that you're getting children into the system and we're not exiting them timely. And I can dissect this a little bit for you more. You do actually do pretty well on timely reunifications. You do really well on placement with relatives. This is your adoption delays. And so there are things you can do in restructuring or thinking about how you equip your system differently around those adoptions without, again, I would stress, don't lose your finger on the pulse of those other permanency outcomes. Those are equally as important. Here you see that your permanence within 12 months, the national sort of metric that we're trying to meet is 12 months. That's what our law requires. Your statewide average is actually closer to 42 months. And it's that adoption that is distorting this. It doesn't show up here in that level of detail. We have additional detail we can provide. But it helps us kind of focus our efforts too, so that it doesn't feel so overwhelming in this complex system. This is really, as a lawyer, how I think about this, right? This is the term parens patriae, if you're not familiar, is the term that really speaks to the state's inherent authority to intervene in the otherwise private realm of the family in order to protect the children who are the citizens of that state. There's a whole set of cases really dating back to the early 20s and then continuing even to the most recent in sort of around 2000, the last time the US Supreme Court spoke to this. But the Supreme Court has said this is probably the most clearest and well-established of the rights of family, the rights of the parent-child relationship, the rights of parents to direct the care and upbringing of their children. We look first to parents to make all of these decisions about how children are brought up, but those rights are not absolute. Parents can't do anything they want with children. If they're making decisions that are not in the best interest of the children, the state has the power to come in and sort of usurp that decision-making. The state then becomes the decision maker to make sure that the child's best interest is protected. And that's really what parens patriae is. It's this inherent authority of the state. You don't have to do anything to get this. This is what comes with government power. This is what we mean when we say the state has intervened in a family. Then we have any number of state and federal legislative enactments, statutes that elaborate on this and tell us with more specificity what the responsibilities are of the state to children and families who are involved in the child welfare system, and most particularly children who enter state custody, where that responsibility is at its highest. So this is kind of the lens I kind of want to introduce to you to kind of move us into other topic areas that are relevant about what states can do and how your system design sort of speaks to some of those outcomes. The funny, not funny thing about parens patriae and all those responsibilities that I just mentioned, whether it's this inherent authority of the state or whether it's all of those dozens of federal child welfare laws or who knows how many state child welfare laws, is there's accountability for those things. And there are lawsuits brought to enforce those things. So there are federal reviews and accountability mechanisms we won't talk much about, but I've selected for you here because Olivia Y is such an important conversation. And in such an important, in some ways, constraint and influence on your system, to kind of put that a little bit in some context here. Child welfare reform litigation is not, as you know, unique to Mississippi. This strategy has been around for decades as a way to transform systems. We are doing a lot of research in this area. Personally, I'm doing a lot of research, and I do a lot of work in this area around class action lawsuits and foster care consent decrees. Got about 75 cases that I track really since the history of the inception of this strategy, the first case, to give you a sense of how these, kind of just the context of this as a strategy for reform. The average lifespan of a consent decree is about 17 years. So you're a little long in the tooth with Olivia Y, but you're not as long in the tooth as Kenny A in Georgia. There's a lawsuit in Maryland that's 40 years old. There are about 6 of them in Illinois that have gone on much longer. So some of these gone quite long and changed that average. But these are long-standing pressures on the system, and some have described them as unbearable pressures. They are expensive, so they stick around a long time. It changes and constrains the decision-making that our leaders have, your leadership, state agency leadership, the courts, changes their decision-making. And it's very expensive. So resources that you might otherwise perhaps decide to allocate to the child welfare system directly are being sucked up into the litigation and the monitoring that comes with it. You can see that from this a bit of a dated study in 2017, that the average fees surpassed 17 million on average, 15 million on average. Again, I can tell you in Kenny A, which I work very closely with for all these decades, there's been a brief that's just been filed in a motion to terminate there that has cited 43 million for our 2.5 decades long lawsuit, 17 million of which is monitoring fees alone. So choices are made. Dollars are policy choices as well. And these lawsuits are consuming a lot of that. You're not alone. This is my depiction of you're not alone. So there are about 21 jurisdictions that are currently operating under some form of court oversight, whether it's a whether it's an injunction or a consent decree or a settlement agreement of some kind with court jurisdiction to enforce. There are these pretty fluid dynamics on this. There are 13 jurisdictions that are in the pre-trial litigation phases. So these are new lawsuits that are depicted up here in the corner, most of them at the state level, some individual counties, like you see some counties in California, Minneapolis as well. And then we also see then patterns of exit. The patterns of exit are much slower. Again, these decrees stay around a long time. But there has been some experience around 6 or so states that have successfully exited their decrees. So I'm really interested in kind of research questions about how effective this tool is and sort of, again, the structure of litigation and what moves these in a different direction. But that's the broad context for where Olivia Y is. You're in good company. And these lawsuits, I think in my view, they've kind of gone through a couple of different generations. They kind of evolve, as you might expect. They're adaptive as well. But broadly speaking, they're brought in the name of several named plaintiffs, alleging individual violations, harm based on any number of these legal authorities that talk about the state's responsibility. So constitutional violations, particularly around substantive due process. These are children's rights to be reasonably safe in foster care, to have adequate treatment while in foster care, to have their family integrity honored. Are we trying to reunify? Do they allow visits? That sort of thing. Also procedural due process that tends to come in a couple of forms around like right to counsel, lots of statutory claims. These are on the permanency timelines, services being provided, case planning, that kind of thing, and then state statutory rights as well. Really, this is how they're structured at the outset. This is what you might otherwise expect. It's, in my view, when the class is then certified and they move forward in these broad system reform, kind of seeking this comprehensive reform of the system, they really turn into something that's less about an individual right to harm and vindicating that right, and more about a group right to a competently administered system. So then it's really about, how is your system designed? How is it functioning? Can it self-assess? Can it identify its own problems? Can it self-correct? Couple of things I've selected here, tying back to mental health and thinking about the system design and the harm we talked about at the individual level. What can systems do better? And this is in no way exhaustive, just giving us a jumping off place and tying into, I think, some of your topics of priority interest. I think you gotta be really clear about the goal. What's our goal for children is really to make sure they have a nurturing and committed caregiver, a stable routine, structure, reasonable expectations. These are the things that promote healthy, positive child development and mitigate against some of those traumas and precursors or exacerbating factors for mental health. And then on the mental health side, right, we need an adequate service array and a provider network where you have people who are specialized in pediatric work, where they understand the context of foster care and trauma, and can meet those needs. So speaking in those couple of directions, and just to also add, kind of co-sign everything the commissioner mentioned, there's questions about funding and otherwise, that all, of course, is involved with all this as well. Two areas of particular attention at the federal level and in all states right now, also I think relevant to what you're working on here. One is around quality legal representation. So I quickly tried to convince you that this is a really complex, nuanced area of law. I'm a lawyer, so you have to buy that. But it's just true. We're talking about constitutional law, we're talking about statutory law, we're talking about the intersection with other areas of law, and the protection of the various rights of multiple parties and the exercise of state authority. And so really at the end of the day, lawyers actually do matter in this system a lot. And so I think the reintroduction, or really the highlighting of quality legal representation, is something that us lawyers in this system really care about, which is to really think about lawyers as tools that are needed and that can help facilitate a process to get us to not only the protection of rights, which is really important, but best outcomes for children and families. And so something to be embraced, not something to be kind of avoidant of. The quality legal representation, again, growing body of research here that's propelling some of this work. You see here outlined on the left just a number of areas where their research has found that lawyers make a difference. Lawyers for children, lawyers for parents, lawyers for the state, high quality, specialized, dedicated lawyers, certainly again, protect rights, they facilitate participation. Why does that matter? That because even when the results of court cases aren't in the parent's favor, they're more likely to accept those results if they feel like they've been part of a fair process where they have been heard. So all the perception of fairness. Importantly here, especially as we looked at that permanency data, reduction in permanency delays, and facilitation of other positive outcomes that we're seeking, better work on case planning and the use of case plans as a tool for remediating safety issues. Again, facilitation of visitation, that's about family integrity. It's also about children's mental health and the prospect of that family strengthening. Empowering families to keep children safe at home, better judicial decision-making, and cost savings, because all of those things create efficiencies in the system. To do that, you need a system of representation that has these features. And again, research-based, not just my opinion. I think some of these things, though, resonate with your common sense. Clearly defined roles and expectations, reasonable caseloads, fair compensation, standards, specialized training, effective supervision, opportunities for clients to provide that feedback so that you know if you're providing good services, and then access to an interdisciplinary model of representation, meaning not just lawyers, but lawyers plus social workers who are part of the legal team, not the agency, but part of the legal team, and also peer partners. So people who've experienced the system, who can help have a different level of trust and rapport to support parents and children as well to navigate through this complex system. Focusing on the agency specifically, because of those things, those features I just really quickly went through, this agency model of representation is sort of held out. There's probably the least amount of research on the agency model of representation in contrast to children and parents. But even here, the research that exists is one that says this model is probably the best model. And I think it's the one that you all have been exploring and the best of my understanding and exposure. The idea here is that the agency is the client of a lawyer who directs the litigation based on the litigation goals set by the agency as client. But in that relationship, it has all of the qualities that we would enjoy with a lawyer we would hire: loyalty, confidentiality, communication, competency. And the competency comes with a lot of this specialized training, dedicated focus and related features that we've already reviewed. So the benefits of that model in particular here, right, speak to the agency's familiarity with the child and family, most importantly, with the kind of unique goals of this system. This isn't just a linear litigation process. This is one of those areas where decision-making at all, offers all kinds of on-ramps and off-ramps, and that all of those should be well understood, strategically considered, and put into place through a legal process. And around safety and permanency and well-being, helps with consistent decision-making and interpretation of laws so that we have more consistent results, less of that variance and ambiguity, or arbitrariness rather. The caseworkers themselves, their expertise is really highlighted in this model as opposed to the lawyers themselves. And then that really speaks again to a grounded familiarity and commitment to the work, which matters to keep up with all this changing dynamics. That's quality legal representation in a nutshell and how I think it's grounded here in your context and interests. The other is when we think about mental health, what can we do to actually prevent unnecessary family separation? Recognizing in the scenarios that the commissioner mentioned, those are cases where the state should intervene and those children need to be removed. But as she also mentioned, as you know, you have about, again, not unique to Mississippi, but about 60% of your removals are for neglect. That tends to be questions of deficiency, sometimes resource deficiency in the family. Lots of removals for drug and alcohol abuse, lots of removals for inadequate housing. I think it's fair to think critically and deeply about whether family separation, especially knowing the harms that it causes, is the right solution for homelessness or for unsuitable housing. It certainly is a child protection intervention, but knowing that it comes with its own consequences. What can we do instead? What has the research over time taught us is a more effective intervention that really in some ways is summed up in the opportunity that is the Family First Prevention Services Act, passed in 2018, creates new opportunities for all states. All states are working to implement this. This is the 4E Prevention Services Plan that the commissioner mentioned that you may have some existing familiarity with. The idea here under Family First is to create then opportunities to intervene with families using evidence-based services and programs that are more effective to resolve their problems than entry into foster care. There's federal money available for that, so long as you meet all the conditions, and they're rigorous. And that's what this plan opportunity is about, is to demonstrate to the federal government, to their satisfaction, that Mississippi has a plan that understands how this can work within its system, and that this is going to be used in ways that, again, promote the outcomes that the federal law seeks, that you all share. So what you can do is once this is in place, once the plan is submitted and approved, the state will be allowed to start claiming Title 4E dollars. Those are federal entitlement dollars for providing evidence-based programs to children and their caregivers of children who are at imminent risk of entering foster care. So preventing the removal and entry into foster care, not the harm perhaps itself, but our response to it being more robust through these evidence-based interventions. Those interventions are kind of exist on this menu, this clearinghouse, where the federal government has gone through a process of evaluating how effective they are. And so we have to select from that. And they have to be in these three categories of mental health, substance abuse treatment and prevention, and in-home parenting skills. Where are those drivers of entry into Mississippi's system, just like drivers in every state system, where we can do something different if we had a different tool? The different tool here is research-based interventions, and the capacity is through the allowance of federal reimbursement to create those services and use that as an alternative. So again, that plan is it has been in development for quite a while. It's been my privilege to be part of that work that allows us to tell this story, even in more elaborate form than we've had time to do today, about Mississippi, about the readiness of Mississippi. Mississippi is submitting its plan later than other states. Most other states have now. It's one of the last states to submit and have it approved. I actually am not bothered by that for you. I don't know that you're bothered by that either. I think there's an opportunity from learning from what other states have done. And I think in the end, it really just matters that Mississippi is ready to do it now. And had you done it rashly before, it wouldn't be effective. Now there's deep thinking and good planning around how to make this be a useful tool. So the services that Mississippi has currently selected and proposed in this plan include Healthy Families America, which is a home-based visiting program for pregnant mothers and their newborns 0 to 24 months, again, to prevent entry. So a lot of family strengthening and learning how to parent when you're overwhelmed by that opportunity. Also Home Builders, which again is a longstanding, well-established program that is about preventing, again, addressing sort of at risk within families for entry into foster care, particularly also on the back end, so aftercare. In Mississippi, we struggle, Olivia Y points this out, with re-entry into the system and maltreatment in care. And so you're not removing the wrong children necessarily, or not moving too many children. The rate is on point. I think, again, we have to think about which children and how we're making those decisions. I think also that you're keeping kids in care too long, but also when we're sending kids back home, meeting those timelines for reunification and otherwise are things we'd celebrate. We don't have anything in place for those families. The risk probably still exists in ways it may not exist in our families. So if we can do something for those families, and we now can. So some back end work on aftercare through Home Builders. There's also Intercept with it, which is provided by Youth Villages, again, about reentry and at risk. And that actually is keyed even to older children. And then motivational interviewing, which is a tool, a case management tool that some states are adopting and Mississippi has proposed. It's really about creating a more robust and equipping the workforce in their work with parents and families more effectively, and their providers as well. So it's like an engagement model where there are skills for how you might then recruit families into their own sort of service planning and self-determination in their families. I think that's it. That's at least what I had for you. But again, I invite your questions about these things or anything else, and I'm happy to navigate that with your great team here in ways that help you.
Clarification, and I'll go to the rest of the committee for this. So first of all, thank you. It was a very thorough presentation, and we appreciate kind of seeing what other states are doing and kind of where we are. I want to go back to the area that you talked about or was problematic, and we've done some things in this arena, but I still think we're lagging. And that is permanency, the path to permanency. And we've done a number of legislative changes, but we still are behind and struggling with this. You said the national average is 12 months.
That's the national goal. That's the standard the national government has set. And that's
Where's
based on
that measured? Like what point do you start the time frame? Is it the moment a child comes into the system?
Yes.
Okay.
12 months from entry. And those timelines, again, come from federal law, from the Adoption and Safe Families Act. And when that was negotiated in Congress, I mean, you can argue it's a little bit arbitrary. It's a timeline. Often they are. But the idea behind it was to really respect a child's developmental needs. And the idea that, again, family separation is a profound experience for that child and also for the parents. We want to keep that as limited as possible.
Okay. And so I know a number of states have done some revisions on this. Is there a state that you can point us to, or a couple of states that you say they've got this right? They put in enough protections for the families that they're being removed from, but yet they've done a much better job at moving it to permanency. I know we looked at Connecticut. I believe we looked at South Carolina. We looked at a couple of other states. I know when we were doing this last time. Is there somebody that you can point us to that we should really be looking to see what they do differently than what we're doing?
My answer is like that fun lawyer answer, like it depends. I don't know that it's the right question. It's the right question. There isn't an easy answer to that because there really isn't a state where you said this entire state has a model child welfare and foster care system. You have states where there are points of emphasis where performance and outcomes are better. And I think where your points of emphasis are very much about your values here in Mississippi. So let me give you an example. Alabama, your sister state,
right.
There are lots of outcomes there that are subject to criticism. They do really well on relative placement because they have an investment in relatives. You all do a lot of relative placement. I'd say you're already moving in accordance with that value, but the relatives here, it's true in Georgia as well, don't get any financial support or service support. So they remain fragile. You do a good thing, and then there's not enough support to sustain it and strengthen it and allow that to be a good result. So that's an opportunity that I see for you. And it comes also through Family First. They can provide those services to relatives as well. But there may be other ways that you can think about the financing of the system and where there might be opportunities, TANF or otherwise. You mentioned that earlier, to think about how you might support relatives who've taken in children kind of unexpectedly.
Okay. Is there any other things like that? Any nuggets like relative placement? Alabama's done a good job at that. We should look at what they're doing to incentivize that. Are there other things like that that you can give us specifics on that says you need to go look at this?
I think, again, so I would say, in some ways, I would like to say I'd follow up with you because I think it really requires a different level of drill down.
Okay.
So when we think about Mississippi and the idea of re-entry into foster care, recurrence of maltreatment, those are questions about aftercare. So we can get you to states that have more investments in post-permanency. When you reunify a family, what is the array of services that are still provided, even though the case is closed? A particular court case, right? So those kinds, again, those are choices about what you want your system to do, but it starts with where you're starting. And I hope that's what we've supported here, which is to understand the narrative of your system.
Right.
You don't need, like this, you're not a overloaded front end. You are a nuanced permanency conversation. You are a choice around permanency options, relatives, reunification, adoption, guardianship. That's part of your decision-making. You are support on the back end of permanency. That's what you really need to focus on.
And I would say too, our numbers are probably longer because we are trying to do that reunification process and we're giving it more time to reunify with family. But we want to get on the front end of this, of not bringing them into placement.
Yeah.
So that's where, but as to use your adage, when the foot has to be amputated, we do need to figure out what we do then to get this child some, create less trauma for the child and get them into some permanency.
Madam Chair, I think it's really exciting to me as someone who's done this for a long time and worked in legislatures and made my, drafted stuff, like been a part of the design creation of something that doesn't seem like it's really working. With Family First, I think in part, you can think about it, if we can be more targeted in our interventions and obviously more effective and responsive, we're siphoning off, and I don't mean to put it in these terms, but I think it's maybe descriptive, like kind of the white noise, right? The kind of cases that don't belong in the deep end of the system that are keeping us from doing the detection of real safety issues and getting that right. And so we can do better if we have a little bit more of a sophisticated kind of discernment among the types of interventions that we have and the families that we're intervening with. That's the goal of that. And I think it has that potential here.
Okay. Other questions? Senator Wiggins, go ahead.
I was going to let somebody else go, but that's fine. Can you go back to the slide, the parent up a tree slide or whatever that is?
Oh. Probably soon. Yeah. I'm sorry, which slide though? He cues it up.
The one, from the case, the Supreme Court case?
Oh, sure. The parents' patriae. Sure.
Yeah. And while you're doing
There you
that.
go. Yeah.
And I think I see this as what Commissioner Sanders was saying, but what it says up there, it's cardinal that the custody, care, nurture of child reside first in the parents, whose primary function include preparation obligations. What Commissioner Sanders said is what I think is there. And let me put it another way. The government should be a last resort.
Mhm.
The problem within the state and others is that people think the government should handle things within the family child space. And to Commissioner Sanders' point, and I personally seen it, I guess if you go with the worst case scenario, the government should come in when the child is actually being threatened, physically harmed, whatever. But instead, be it judges, be it whatever, the government comes in and says, I'm going to take your kid because you're on, you did cocaine. And so my question is, that being the case in your studies, have you seen other states or what can be done to make sure or to help that the family unit without is they're raising the kids and all that? And I know that's a very broad question.
Yeah.
But
I appreciate it though.
Huh?
I appreciate the question. Yeah.
Okay.
I think you're wrestling with, I think this always is child welfare. Even in the way I was.
That's the question. This is what goes on.
I'm sorry. Yes. So I'm sorry to interrupt you. I was, when I think about this, I think about child welfare as being a question of state responsibility, right? When do we intervene? When we intervene, what are our responsibilities, right? When do we choose, when do we choose not to intervene, and what's the government's responsibilities to families outside of government intervention? Here's what I would say about that. Yes, I think government should exercise restraint in intervening in families and separating families and exercising custodial options over children. That should be reserved for children who are unsafe.
And let me just stop you right there. But I think to Commissioner Sanders' point, that is not what the culture
Agree.
has developed, in my opinion, around this whole system.
I think that's right.
You agree with that?
I do.
Okay.
And I think what happens instead is we're actually not that disciplined and grounded in this reality of like, where is the authority? And we don't have consensus about how to use this authority. That's clear. And so what happens instead is we all just get reactive based on our own experiences, right? We've all been children. Many of us are parents, right? We're all part of families. And so we have this innate like judgment about how other families are living. And I think that there's a place, maybe just an unavoidable place for that. But that's not the same as this, right? That's not the same as choosing to exercise state authority and coercively remove children from families. I think the other question, though, is harder, which is the reality is this system, too, is not, we have expectations of it that we're protecting children and strengthening families and doing all these things at once, when it's really set up to be very reactive, right? It's a complaint-based system. A child has to be hurt or at imminent risk of harm for this to be triggered. How unfortunate, right? So I do think there's a societal also desire to have families that are strong so that we can have the luxury of allowing them to be autonomous, right? And so that means I think there's a different question that's harder, maybe even harder to answer, or equally as hard to answer, about what is government's responsibility for creating stable communities where families can be strong and thrive on their own so that we don't have to use this authority to step in once a child's already been hurt, right?
Okay, and on that point, what have you seen, to the chairman's point, what have you seen, what states are doing that part right?
Yeah, so the one that stands out to me, I don't know that it's always a helpful example because it's a small state. So Delaware, which has like 3 counties, does a really robust work on the community investment side, where for families that have been system involved. So there's a couple of things I want to say about this. DC is another one. DC, I'll start there maybe. DC has a really tiered structure around prevention. So they have all kinds of work that's done to promote community, access in the community to services and supports for families without having to have child welfare involved. So families there's just investment that the government has catalyzed in local service array, so that there are services you can go to if you have a problem on your own without government making you do it, right? And risking family separation. So DC is one. Delaware, I started with. Delaware is similar. They have created kind of this front door prevention, but they started at the back end. And for system involved families and children, they allow you to, so you have your court ordered services, and then your case eventually closes. They still allow families, those service providers with investments of government resources and private resources, allow for families to continue to come back for those services, even though the case is closed, kind of on their own. So once they've learned how valuable those services are, and they also don't feel like they're doing it under threat, then you just now have a different resource. When you have a parenting question, when you need some additional support, when your stress levels are too high, whatever that is, or you need clinical intervention for mental health or substance use, you can just return as sort of a former client of this service provider and avail yourselves of those services for free. So that there's, again, just this fabric in the community, again, catalyzed by government investment, not exclusively, but it just now exists so that families can, when they're organizing themselves like we want them to do, have more tools for themselves than what they may have on their own.
Senator Hickman?
Just a couple of questions. One thing you brought up was that Mississippi does a decently good job at placing children with family members and things of that. But you brought up a very valid point that I've looked at, and that is that some states have created or come up with a mechanism to be able to pay family members who may not be licensed foster parents, but they receive payment for the child. Because one of the issues that I've seen firsthand is that a grandmother says, look, I don't want my grandchildren to go into the system, but on my fixed income, I can't afford to bring 3 children into my house and properly take care of them. I guess my question is, states that are or have come up with a mechanism, I think you mentioned Alabama, how these payments work in a sense. And another question I have around kinship, and again, this is something that I've just looked at, I think is low-hanging fruit that we can capitalize on, defining kinship. How are states doing that? And what do you think about how kinship could be defined? Because sometimes it's like, if my child has spent the night at my neighbor's, half of her life, is sometimes better. They may not be blood related, but it's sometimes better for them to go there, and it takes away some of the shock of them being placed in a new place. So
Yeah.
kind of a 3-part question.
No, that's great. I might have caught 2 of them, so catch me if I don't address the
Go
third.
for it.
I'll start where you left off, recency effect, right? Defining kin. I am a fan, I think even in our constitutional jurisprudence, there's recognition that something beyond the nuclear marital family is still protected within this realm of privacy. So if we even take it from that place, I would start there. There are cases that say that. So we start with extended family, the obvious kind of candidates here for who kin might be, grandparents, aunts, etc. What you're talking about, though, I think is really where things have evolved, which is to understand that family dynamics and composition is often about the function of the family and not so much the formality of those relationships. That I may not ever really know my aunt, but I know my neighbor, and that person is someone who meets all of my needs of protection and security and et cetera, like a parent would. And I had someone like that. So I'm also, let me just disclose, I'm like eking in my own personal bias here, right? If something had happened to my parents, my Aunt Kiki would have taken me in. She's not related to me. So the idea that the law would support an assessment of relationships that are about function as well as formality, relationships based on blood or legal ceremony, but also function, I think is really important. So states driven by federal laws or encouraged by federal laws have started to use this term fictive kin, if you've heard that. Fictive kin is really about recognizing those relationships that are not defined formally by blood or legal relationship, adoption or marriage, but instead are about who we see as the people who love and protect us. So I think that's really important to use that construct expansively and to build in the tools for child welfare and those assessments that a caseworker might be making when they're talking to a family, to think broadly and inclusively about those resources. So that's one. How states have been doing that, yes. So, when relatives take in children, just by default, they're really only eligible for the set of public benefits that they might otherwise be eligible for based on state eligibility criteria and federal eligibility criteria. So things like food stamps really depend, right? You have to meet those needs. So where states have augmented around this placement issue is usually with state subsidy, so state funding. Sometimes TANF you can contour in ways that can be really helpful here as well. And it really is about a point of placement payment. So when you go to grandma and say, Joey's coming into foster care. Grandma, are you willing? Grandma says, yes, but I can't do this based on all the things. One is just a per diem that would be using, again, more flexible funds like state funds to do the same kind of per diems we would do for foster parents using a combination of federal and state funds. And it really is in recognition of everything that you said, that it may not be necessary for that person to go through formal foster parent training to get licensed or approved in order to access that money. We just need to secure that placement. So it's a choice to be made with those dollars. I think that's been really helpful. The other thing is just around some concrete supports can go a long way. So having there are federal funds that are available to the agency that are about preventing unnecessary placement and other kind of concrete supports, but they're very limited. So having, again, some supplemental funding available to say, grandma's willing to take little Joey in, but she actually doesn't have a toddler bed or a car seat or daycare, right? So how can you use childcare subsidies? How can you access some concrete supports to put together a package of solutions for that grandparent? Is kind of how states have done that. Alabama, I worked with them several years ago to create their federal guardianship subsidies, the program that allows them to access money through the federal government for guardianship. It was interesting to them to even talk about that because they had been doing guardianships with relatives for so long using state dollars. So again, these things are possible with an intention that can be designed and resourced to be very effective. I might have missed your third question.
Well, I think I don't think you missed it. I don't think I asked it, but it was. Can you go into how states who have begun to define fictive kin, how are they defining that, and what's the steps that CPS have to use in order to say, oh, well, this is what qualifies fictive kin, and let's just say we get into the point where they're able to receive the child and service and all that. Who are those people?
Yeah. So it starts with requirements that the federal law imposes on states to do what we call diligent searches for relatives or fictive kin. States have defined that using different choice statutory words, but it often is described in some way as being someone not otherwise related formally that has an ongoing and committed relationship to the child. And that may be very well as far as the law goes. And then it allows for, again, the worker to do that authorizes a worker to ask those questions and then make themselves the decision about whether this person, neighbor, in your example, actually represents someone who I could justify as being someone with an ongoing commitment to this child. And then so there's a construct for it in the law, and then all of the kind of practice and ground level work to make that a quality decision. You're welcome. Thank you.
Additional questions? Okay. Commissioner, will you come back up? Because I've got a couple of things I want to, thank you so much. This is helpful, and we will be in touch probably with more questions.
Sure. If it's fair to say, I don't want to lay an unfamiliar, but Mississippi's kind of become a little like a second home to me. So I'm really just glad to be helpful to you. I want to be helpful. Let me know how I can be.
Thank you
Thanks for
so
the opportunity.
much.
Thank you. Thank you, Ms. Chairwoman. Commissioner, I just wanted to publicly state how much I appreciate you. Each and every time I've ever called your office, you return my call in a timely manner. Your staff's very professional, how quickly that you respond to the needs of the constituents or the issues I call you with. And I wanted to publicly thank you. We have bureaucrats in this state that do not return phone calls unless you use your title and really bear down on them. But you and your office do a great job, and I wanted to state that publicly for the record. Thank you.
Well, I just want to say thank you. I don't get that very often, so I appreciate it. I am not a bureaucrat, and I will probably work myself into the ground by the time I finish this job, but I think it's important, and I think that it can change our state.
Yes, ma'am. And, I don't think bureaucrat's an ugly word. I think it's a public service, and you take it serious. You return the phone calls and do everything you can to provide the information and help those. And there have been times where I have, brought it to people's attention when they don't return phone calls when we have a hearing on different issues. But I wanted to say publicly for the record how much I appreciate you and your office and the job you're doing.
Well, thank you. We do make some mistakes. So if you don't get a phone call returned, no, that's why my cell phone's on my card. Don't mess with mics.
Yeah, I was texting at 9 o'clock the other night with the situation, but I want to thank you for this. I want to go back to, I'm going to get your suggestions on this. As you were mentioning the licensure issues, and you're mentioning really the different commissioners and directors and whatever title they have, that we were have of those different agencies, because you've got about 5 agencies that you really interact with. Would it be better to form a commission like of y'all, like have some legislation that forms this, that looks at licensure reform, also looks at your different agencies, to have a task force really of y'all and different experts looking at that as to how that we could align your jobs better, so that when somebody needs to open a agency, they're not dealing with 4 different entities. With that, is that what you would kind of suggest would be the easiest process?
Procedurally, I think this body may have more expertise in what has worked than I do, but I think that my colleagues and I are open to open conversations, and that we do have a lot of the, I know the tendency has been to ask us individually and then try to piece all that together, or not to ask us. And I know that there's some reasons for that. There are people who came before me who have eroded trust on on behalf of what I think are public servants. So I understand that, but you have human service leaders right now, and we've all been in our roles a pretty long period of time, relatively speaking, and I think we certainly could contribute to the right answers.
Well, I have a great deal of respect of all of you, and I think probably getting you all at the table with some additional people would probably be the best outcome, but I wanted to ask you about that
Thank you.
particularly. I was going to ask you something else. Does anybody else have any questions for her particularly? Omnibudsman, that's what I was going to ask you. I brought that up in a conversation with you. We need more foster families.
We do.
And bringing up an issue that Chairman Wiggins brought up, that is, we do need all the support services, volunteer, and that's what you see in some places. I think maybe why some communities you were taking less placement of. I thought of the county that you brought up. They have a wonderful CASA program. They have a lot of volunteer agencies around there. So there is a role for our churches, our volunteer organizations, and all of that. And I think that it is no question, just briefly looking at the counties and your placement, that the counties that have more developed resources, where there's more volunteer groups and stuff like that, is you see less children in foster care. And that probably is a true cause and effect on some of those things. But one of the issues too, I know that you've worked very hard with, and when you came into the agency, was trying to help foster families really feel empowered that they could help these children or whatever. And I've asked you about this, would you be opposed to, and we've had this privately, but just kind of, is that more of an ombudsman that works within your office, that when foster families, because your caseworkers, some are on emergency calls, their own things like that, that could really help these foster families work through particular issues, or if they're having a problem with the caseworker, that they could call directly and work through that directly with an ombudsman, if that would be a help to your agency.
I would definitely not oppose that. We're already making moves internally, and I can tell you that this is an area that we've fallen short in some internal reorganization that I still maintain was necessary to get each person a manageable job that they could specialize in. But we're weakest right now in foster care recruitment and retention. And that has to do with how two different groups of people interact with those families. One observation is that our private nonprofits have not been allowed to recruit and retain what we call regular foster families. I don't know the historical context of that or why, but I think that we need all the help we can get, and they are uniquely and well situated to recruit and also to meet the needs of foster families. Fostering is hard. And if you haven't seen the movie Sound of Hope, Story of Possum Trot, it'll change how you think about it. It is, and my staff, I'm barely staffed to cover an 8 to 5 shift. We're getting there. But our ability to kid glove or handle and help a foster family is really limited, and that's not an excuse. One of our primary objectives, I just spoke to all of my staff yesterday at a conference, is we're going to keep kids in their home base, so keep them in their communities. We're going to quit splitting up sibling sets, and we're going to treat foster families like valued customers. They are a resource because we don't have bricks and mortar that we have to have. But being more strategic about how we recruit and using we have a pretty robust network of nonprofits who've been in this space for a long time. And so this is the RFP I was talking about, where, I either had the option of going to the board to get on the board for the next month's board to get the thing approved, which would put me in December before I could let the RFP out, or defining it as an emergency based on the influx of children. And I fully stand behind my decision to define it as an emergency, and we'll also let out a regular RFP for unknown vendors that might want to come into the state. But I got to move on this. I can't wait. We're down to 1,500 licensed foster families. The other thing that we're doing internally is that we are revising our standards. Through the years, as the state's been in this lawsuit over safety of children once they're in custody, the response has been, it appears to me, to just latch down on more restrictions, more, if children aren't safe in a home or a group home that has one nurse, let's make them have two through the night, all night long. Well, what that does is it means nobody can meet that standard. So, there's got to be some balance. So we've rewritten our regs. We're about to publish them to just align with state and federal statute. We don't have to go above that. And then to invest in safety rather than trying to eliminate unsafe places. So if the issue is that they have, great aunt has a home and it only has one bedroom and she's got two of their cousins, but they've been spending half their life there. Let's talk about how we can make that home safe and set her up for success so that, otherwise the solution is those kids may end up anywhere in the state. But foster families are an extremely valuable and fragile commodity resource. And I think we've got to do better at appreciating them. I've got to have a better, more direct feedback loop with them. So we're working to build that internally, that I would not oppose an ombudsman or a more formalized process. And I think in the end, I take some ownership for that. I'll say that.
And I think it is much improved. And we're going to take a break in just a second, but, and I'm going to take kind of a personal privilege just to thank you on a personal situation the other night. That is when we go too far. Because, people talk about we're not removing children enough, but this was a situation that I got called, oddly enough, on the way home from the youth mental health task force with a family that had been in the ER. And the ER had somebody that was from a clinic located outside the state the family had brought the child in with an emergency mental health issue. And, but the child had calmed, it was fine, it was good. And the parents, the clinic that was doing the intake wanted to put them in their facility for at least a 3-day stay, 11-year-old child. And the family said, I think this would bring more trauma to the child. They consulted with the pediatrician. They got a whole different treatment option. But the individual with that facility says, if you don't do my exact option, we're going to call CPS. They had made a very reasonable treatment option, and they did call CPS. And CPS had to go out and investigate this lovely home, of which I showed up to, with that family and with that situation. And that is when they've used CPS. They took resources up with a family that their pediatrician was with. They also were working with their community mental health center. They had set up a very good, different treatment option that family had, very proactive. And so I called her and I said, wait a second. And so I think that's when we've got to step back and we've got to make sure that all of our medical professionals, just because they choose different options of treatment for their families, it does not mean that they are neglectful or abusive of a child. And so CPS did their job, everybody's good, but it was a situation that was complete abuse, in my opinion, of how we're using the system and the resources. So anyway, that is a personal note. And I've come to find out there has been some national news articles and different things like that of kind of these very same situations. There's been some podcasts and things like that. So it is a situation I apprise everybody of, but let's make sure that we are using CPS for what CPS needs to be used for, and not because we want to object our opinion as to what things exactly need to be.
So thank you for bringing that up. And if I do have just a minute to elaborate on that. Many of your body here in the Capitol have had similar experiences. And first I'll say, when I get that call from one of you, I feel like it's important for me to let the process follow the process at that point. You don't want me intervening, and it doesn't do the family much good in the long run. And I've had personal friends call me with similar situations. And so I monitor the process and ensure that we do what we're supposed to do. But when I tell you, I heard your voice crack, it is a painful process. And, you know, for people who have resources, means, connections to people, it changes their family forever, frankly. There's some trauma that goes along with just us investigating. The other thing is it is a distraction of our resources. And one thing I'll say, I know Melissa pointed out that our rate of removal is just a little above the national average. That was 2023. If you noticed in our other graph back in 2016, 17, really between 14 and 17, our numbers spiked astronomically in the state. So our rate of removal then would have been twice what it is now, if not more. And we're on that upward trend again. And I'm not someone who calls it a trend after a couple of months, but we've had now 15 consecutive months where the number has increased on the first day of the month, every month, by an appreciable amount. So, you know, if that means that many kids need to be in the system for their safety, I'm on board. But it's not something, you have a limited resource. I have a limited resource. And it's very important that it serve the purpose that it's charged with. So while our rate of removal and our front door doesn't look as bad as our permanency, I would invite you to take a look at that entire intake process. And let's ask ourselves, does it make sense? Are we putting final say on whether or not the agency goes in and investigates on one person? And if we're going to do that, this intake unit of the youth court, they're going to need more than 6 hours of training. They're the decision maker. And so they need to understand child development. My staff have to have 270 hours of training before they set foot in the field. So we need to hire mental health professionals. And then I think there needs to be a process for decision-making that doesn't leave the decision in one person's court. So.
Senator Blackwell has a question.
Yes, sir.
Thank you, Madam Chairman. Commissioner Sanders, thank you for your presentation. And also thank you and your staff for the work you do on behalf of the state. I was going to wait for this question tomorrow with DOR, but I thought you might know. In 2023, we passed a bill to allow a $10,000 tax credit for adoptions. Have you noticed any increase in adoption since we passed that bill?
I don't think we have a shortage of people who want to adopt babies and small children. So I don't have data specifically on how that's impacted our adoption numbers, but I don't really think that's the issue. The issue is whether we get that legal case to a position for adoption cleanly. And that means due process throughout the entire case. And that means that every decision the prosecutor, whoever sits in that role in that county, makes in the early part of the case sets the tone for the rest of the case. And I made a note here to bring up to you use of aggravated circumstances. As a lawyer, that's just one example of Well, we're doing it two different ways. Some places use it excessively. Some places don't use it at all. It was removed from my kids as an option 3 or 4 years ago by one person, which basically changes the law. It wasn't in there as an option. So we need aggravated circumstances if we're going to convince the community that we can keep children safer by not bringing so many into custody. We got to be there for that kid who's in the cage in the closet. That one has to come out. It's gangrenous. But we also have to, so to that point, whoever's going to bring the charges, I would argue it's more of a case. Whoever's going to push the case through the court needs to understand the implications from start to finish. The burden of proof increases at every stage of the proceedings in Mississippi. One thing I did not say to you about what I consider a model green court is that it does need to have full constitutional authority to hear every phase of the case. And I'm unequivocal on that. When we start separating all that out, you got to file a new cause of action here. You got to have a different party here. There are some things we're going to take advantage of internally, but we got to clean that path to permanency, and reducing timelines. It only works if the systems are in place to do that and if there's enforcement of it. So, I really think looking at legal procedure and setting up a process that is designed for kids to move smoothly through the system, to give parents opportunity early. And if that's warranted, if there are aggravated circumstances and the child's been put into a coma by his parents, that child doesn't need to have supervised visitation. So we're all over the map on that in Mississippi. And that's why I think it's really critical that we have the right lawyers in place in the Uniform Youth Court. I had a whole slide presentation and I've not gotten into it, and I'm not going to, don't worry. I see everybody's like, what? But I know Senator Bryan also passed me a note that I'd like to address or let you ask your question.
I have a rant, but I'm not going to deliver the rant if I can just tell you the topic of the rant. And basically, if you think for a minute, we've got a pretty good group of agency heads, good folks, competent folks, honest folks. The governor may be responsible for a lot of that. Not all of it. But over and over and over, these people come and say, I can't run my agency because I can't hire folks. I can't hire them quickly enough. I can't pay them competitive salaries. And I can't buy anything because there's so many protections against misappropriation that I can't ever even appropriate.
We've regulated ourselves to death, is the way I like to put that. And I am a firm believer in accountability. I came out of DHS during the dark days. You can't trust every agency head, but you also can't handcuff us to the point that we can't get the necessary care for kids. The note that was passed to me had to do with the greatest need for treatment facilities. And I would add to that a full continuum of care for kids, and that needs to start in home-based, community-level treatment. Most children do not need to come out of their homes for treatment. Putting a child in a hospital for behavioral health purposes is like a separation from family. It causes trauma. It's necessary in some cases, but we are overly dependent on it in Mississippi. We have a very acute heavy system. The reimbursement drives that, and we need community-based wraparound levels of care that's paid for. And I believe that you could divert the high number of kids that we're growing into teams that nobody knows what to do with.
Thank you so much. We're going to take y'all 5 minutes. Everybody stand up and stretch back, and we're going to start back at 3:15
Thank you.
promptly. Thank you so much. All right.
I love this.
Good.
Good.
Yes, ma'am. Yes, ma'am. How about you?
One of the coolest things they come up with.
Good. I did not know that. I did not know that. If you ever need me, tell her, let me know.
Well, I see that.
All right. I know who that is. Yes. I got that one. All right, y'all, we're going to start back. And we are so honored today to have our Attorney General with us, Attorney General Lynn Fitch, who our last task force, she and her staff worked along beside us to help us work on a number of that legislation that we passed over the last 2 years. So they've been a good partner with us in trying to help further women, children, and families in the state. So General Fitch, if you will go ahead.
Is that better? Yes. I have 3 children and 4 grandchildren, so I'm pretty loud anyway. So, first of all, thank you. Thank you so much, Senator Boyd. Appreciate this. This is amazing. Excited to be a part of this hearing today. I know you've heard from amazing speakers. I'm certainly honored. Thank you to serve as the Attorney General for the state of Mississippi. And I do it with a remarkable, dedicated team. Some of my team members are here today. We have attorneys, we have investigators, other professional staff, and they come to work every day with, who can we help today? How can we make a difference? And that's certainly been the model for the Attorney General's office. It is certainly very humbling for all of us to serve the public in everything that we do in the Attorney General's office. But this is such an important topic that is a critical part of the AG's office. So I really appreciate all the committed leaders that have spoken before me. I can't really think of more people than the amazing speakers and the ones that will come after me with such compassion and such conviction to come and talk about this. I know we had 2 of our outstanding judges that testified earlier with Judges Bevel and O'Neill. And then certainly I saw Commissioner Sanders earlier. I know Carla Ty will be speaking afterwards. Again, everybody is working together. We are in this to protect those children, protect those women, but the children in particular, there are predators there. There are evil people out there. And so our job is to protect these children and to prosecute those who have done wrong and are continuing to do wrong for our children. I certainly know when it comes to firsthand knowledge, everyone here in this room is believing in how we can continue to make a difference and then what we will do together. Again, those colleagues that were here earlier, they walk the walk. They've been involved. They understand what it's like for the children and how we make a difference. I also want to take a moment and thank Lieutenant Governor Delbert Hosemann. I appreciate the work here and this committee to be put together. It's really critical. This is a key committee that is, you all are convening and taking information away to be prepared for the next steps. When we took the Mississippi Dobbs case to the United States Supreme Court, we asked them at that point to give the power back to the people to make decisions. that we were ready, we were capable and able to make decisions on behalf of all Mississippians. So I appreciate Lieutenant Governor, I appreciate each of you, Senator Boyd, leading the charge here. Again, to take the time, the efforts that we should discuss these significant issues that are important to the future of our state. Perhaps most importantly too, for all of us is to recognize this, we need to have a continued consistent, a very comprehensive approach on how we move forward. Empowering women, promoting life, protecting our children. We've got to continue to drive toward that. We just can't check the box. There's certainly not that. It's not what we're driven by, not just checking the box. That's why we have to talk about all the things that we can do that are not just good enough, but what can we do that is excellent, that really stands in the pathway to make a true difference for women and children. And we all know that when Mississippi women thrive, our families thrive, and Mississippi is certainly stronger for that. So again, I'm so grateful to each of you and all the work that you do. And I appreciate, your colleagues down in the House as far as helping and promoting policies that make a difference for the future of Mississippi women and their children. Certainly in the AG's office, we've been proud to partner on so many different levels. All of us know it's about partnerships. No one does it alone. We do it with great policy together, with great legislation, with our partners. That's where we make a true difference. 2 years ago, after the decision came down in the Mississippi Dobbs case, it was a game changer. I launched the Empowerment Project. And so I want to talk a lot about the Empowerment Project. And again, I want to thank you all for the vital parts that you each played to talk about where we were 2 years ago and where we are today. But as we crafted the Empowerment Project, we said there are 5 pillars that we need to focus on. 5 very important pillars. Making quality childcare affordable and accessible. Promoting workplace flexibility. Improving our child support enforcement, fixing our broken foster care and adoption systems. And then lastly, giving women the opportunities to upskill, educate, and provide them with resources. And again, I'm grateful to all of you. Thank you. You passed so many pieces that were key to this empowerment, these pillars in the Empowerment Project. And there's so many, but I do want to remind everyone about how significant these pieces of legislation that you all passed were to where we were from 2 years ago to where we are right now. Right now, after all the work you've done, we've made a huge difference. First of all, a foster parent's Bill of Rights and Responsibilities that has been significant to helping attract foster parents. Expanding tax credits for childcare, for adoption, for the pregnancy resource centers. Streamlining the child support enforcement. Again, a very important issue. Expanding the safe haven baby boxes. That's a very safe, anonymous way for a courageous young mother to place her child in the care of others. And since you all passed that, we have 4 baby boxes in the state of Mississippi and some more that are ready to come online. Medicaid postpartum coverage for 12 months. And we've started to overhaul the foster care and the adoption systems with all of the work that you all have done. And of course, my favorite that you all passed, the MAMA program, MAMA, Mississippi Access to Maternal Assistance. These are all very important issues that you have addressed, but let me talk a little bit about MAMA in particular, because MAMA is a one-stop shop for women across our state. And it's got the public resources on the website and the app, it's got private resources, and it has faith-based resources. And again, when you put all those together, that's very powerful to have all those resources together. I'm pleased to tell you that yesterday was the anniversary, the 1st-year anniversary of MAMA. It's great to talk about it here with you all and tell you the statistics and where we are from last year when it launched off to where we are now. Since we went online and we created this opportunity and we put all of our partners on there, in the last year, we've had 15,000 visits to the MAMA website. 15,000. We've had nearly 500 times we've seen that the mobile app has been downloaded. I mean, it's easy. You go to mama.ms.gov and you get our app, and it's right there with this one-stop shop. So I am grateful. I appreciate the appropriation. We've been able to do amazing things together through the Mama program. But if you think about all the lives that we've touched in that time frame, it's incredible. My favorite is when I go different places and I speak a lot around the country and they say, tell us about the Mama program. Tell us what you all are doing in your state. And I'm excited to talk about the things that you all have championed for our women and for our children. But Mama is significant. So I'm always glad to share that legislation with them. And many of them are bringing that online in their respective legislatures. So I couldn't be any prouder than to talk about all those things in the empowerment project you have passed, and then certainly to talk about the Mama program for us. But I want to talk about a few areas as we head into the new 2025 session, which again, it's hard to believe that we're bumping up 2025. There's still some critical areas for discussion and for action. First, let's talk about foster care. As I said, the Foster Parents Bill of Rights has been extremely valuable. Again, you've heard from my colleagues talk about the need there, but I need you to be mindful of, we have 4,000 children right now, approximately, that are wards of the state. 4,000. That is heartbreaking for any of us to think those children are in the system. And then that puts the responsibility on all of us. Every situation is different. Every child is an individual. And so we need to be prepared and ready to address it. Our mission is quite singular, though. For us, if there's a system that's not working, that's not connecting these children into forever loving homes quickly, efficiently, and effectively, then it's simply broken. And so I think we have to be bold and we have to address that. We have to help those mothers that are in situations where if we could just change the environment for them, help them make a difference, and they might not be in that situation where foster care is part of the journey. So I think there's some initial assistance we can provide to them. Second, we really have to streamline the process from foster care into final adoption into those loving homes. It takes entirely too long to get those children into homes where they are loved, where they can thrive. And again, the compassionate parents waiting for those children on the other side. In the Attorney General's office, we work, hand in hand, certainly with our colleagues at CPS, and we appreciate the partnership there. We've done it for a long time. Part of the journey for us in the AG's office has been as we worked through the termination of parental rights, the TPRs. That's important because in the last 9 months, our team of amazing attorneys have been able to legally clear 418 children for legal adoption. So that is a win. I wish it were all 4,000 of them. So again, it's exciting we've been able to make that happen, but we have some heavy lifts that we need to continue to do. It's an important part of the process, of course, but there are many other parts of the process we have to discuss and we have to take action. It is a process. It is a pathway. It is a journey that we have to be there for those children. But if we make a difference in the first impact, that makes it a lot quicker, a lot more efficient, and we ultimately get to the goal of having those children placed in their forever homes. So in this process, we have to look at how we streamline. We have to understand that we're dealing with these children's lives, and that's all that matters. Again, these are our children. I'm so proud to talk about it, and I'm not sure if Commissioner Sanders did or not, but we've been doing a pilot program, and it's been extremely successful, and we appreciate that. So what we've been able to do together is put some of the attorneys that work in the AG's office, and again, as I said, I have a remarkable team that I get to work with every day. But these attorneys have been out there, and we've been in the initial phases of our children, working with our judges, with our referees before it ever gets to the point. And CPS helped to select a number of counties. And so we've been in a pilot program, and it's been extremely successful to see that. So in addition, we looked at how can we be all the way through a part of this child's life? How can we get them to their forever home? We've also been involved in the adoption process. So Rather than going to a private outsource to help these children be adopted, the AGO, the attorneys have stepped in and made that happen. And since we've done that, just since the beginning of the fiscal year, we've had more than 250 of these cases go to adoption. Again, it's a great win, but again, I wish I could tell you we had all of them placed and we had all those adoptions done. Quite frankly, the first interest of our child that we are working with should always be the first interest, should be the last interest, and should always be a priority. So I think we have to stop and realize we're talking about these children's lives and how important that is in their journey. So the changes that are being made to the foster care system, changing the process, have been extremely significant. It's been very helpful. Certainly there are some other areas that we can continue to address. I think the pilot project is going to show a lot of good different options, different journeys, pathways that we can embrace, which provides that consistent representation that this child needs all the way through. And then hopefully we streamline it so it's very quickly done. As I said before, if we need to keep doing this, because if we don't, we're going to continue to see some of our families disintegrate, and none of us wants to see that happen. You know, if we can help a mother, if we can help that child, if we can hold that family together, that is what it's all about. It is about empowering. It's about empowering these women to move forward. In the empowerment project, there's a piece of legislation, and we sought to garnish the wages of someone, or garnish the winnings of an individual if they were to win at the casino. And if they are in arrears in child support and they're delinquent, then the first and foremost, the winnings go to the child. This is exactly what should happen. You all were wonderful. You did that already in the lottery. But I'll tell you again, working with our partners, we work with certainly the gaming community. We've been working with the Department of Human Services, Bob Anderson, and we need to continue to do this. Those dollars should first and foremost go to those children, not be given to the individual that wins at the casino. So the bottom line is, for far too long, women have borne the financial obligations of their children. And I want to give you some very recent statistics because it really brings it home about how critical this is. Right now in the United States, 4 out of 5 parents that are the custodial parents are women, 4 out of 5. And 90% of those who have been ordered to pay child support are fathers. So right now, there are nearly 6 million parents that are due child support every year. And from the most recent data available, not even half of those parents received full payment. And let me say that again, not even half. So those mothers primarily did not receive full payment for their children from the fathers, from the non-custodial. Now that in itself is a very heavy lift. So to put it into reality, that's the difference from a child who might have a good dinner at night or a child that goes to bed hungry. And I think we have to be very mindful of that. I think we have to look at other ways too, besides looking at the winnings from the casino. We've got to look at how we can keep these non-custodial parents from gaming the system. They game the system. They go from one job to the next, and quite honestly, it's their way of not paying their child support. And the child suffers because of that. And the reality is, it's all about fairness. It is about fairness to this child. It is about fairness to that mother, primarily that custodial parent who is trying to raise this child. So legally, absolutely should be accountable. But there are some greater things that come from that if you have the father, the non-custodial parent paying. Because all the studies show that if both parents are engaged in their child's life, if you're paying, then you're involved with that child, which is exactly where we want it to be. We want all parties, all families to come together. Truly, that's a healthy reward if you have both parents contributing to the growth, the development, and the financial substance of that child. So we know that if we can make a difference there, we help that child on the pathway. So let's talk a minute about childcare. As I said, that's one of the important pillars. And it's a barrier for struggling parents right now. It has been, but it's even much worse. But let's talk about childcare in Mississippi right now. Again, it's alarming. Right now in the state of Mississippi, it costs more to put a toddler and an infant into daycare for a year than it does to put a student for college tuition for 1 year at one of our fine colleges and universities. Now think about that. That's a heavy lift in itself. That is a true impediment to a woman who needs to work to support her family, because now she has these outrageous costs. And particularly for those women who lack a natural support system, be it family, friends, it might could help them on behalf of their childcare. It is simply not sustainable to use your paycheck primarily to pay for childcare. And right now, infant childcare alone in the state of Mississippi, infant childcare takes up to nearly 12% of the median Mississippi family income. So you can see there are some issues here. We've got to be very mindful on how we see this as an issue with our childcare. What can we all do moving forward? And I think we have some options and some opportunities to make a difference there. Similarly, I think we have to consider transportation. You can't get a job interview and you can't hold down a job many times if you don't have transportation. We live in a very rural state, and it's hard to be a working parent if you don't have transportation. You've got to have that opportunity to get to and from your job. I think we all need to be very bold again. We need to look at programs. How do we help these individuals? How do we help them get that job, keep that job, be able to maintain for their children? So I think that is an issue that is on the forefront, as well as the childcare. We don't want them to look as a handout. We want a hand up. We want to help them make that next step of their journey a better, a positive one. So I think we have to put all the options on the table and see what's out there and be very creative on how we can strengthen these families, these mothers, help these young struggling parents through childcare, because we all know childcare is not a one-size-fits-all. So I think we have to look at different options and how we can provide assistance to these parents. And it may take a very comprehensive model to do just that. But I believe in Mississippi that we're ready to do that, and we're ready to embrace the issues at hand. Now, those could be simply looking at a different way of, again, it's a comprehensive, not a one-size-fits-all. Maybe there's an earlier preschool that we can get them into. Maybe there's some support for that grandmother or that aunt that takes care of those children while that young mother is at work. Again, you couple that with the transportation, then we can continue to change lives and to help them along on their journey. Having that transportation, supporting those children, I mean, that's vital to their groceries, their well-being, their health care. All of that wraps up together and makes a difference in these children's lives. Now I want to talk about another issue I think that is significant as we're trying to help these young mothers to move forward. We've got to look at simplifying the process of expunging nonviolent misdemeanors. And let me tell you why that is so important. Right now, when you mark that on your job application, it can keep a parent away from working, from getting a job, from paying child support, from building a very nurturing environment for that child. Right now, the process is very hard. It's very complicated. It's very expensive. You don't have legal representation. It's very hard to go down that pathway to have that expungement. I think we can't be timid. I think we have to look at how we can be flexible. What can we do with our resources that make a difference? Be it through our TANF program, other federal public assistance. We've got to tear these barriers down, and we have to do it together. And we have to be very bold in our thinking. We have to be very creative. We have to be very strategic, because again, all of these issues are very complex, but they make up the whole to make a difference in the path forward. You know, parents are struggling in a lot of ways. You all have seen it, you have embraced it, you've made a difference, and I want to talk about some of the legislation you passed. And I want to tell you thank you. First and foremost, you passed the Walker Montgomery Protecting Children Online Act. You all have heard that testimony. You know it. You know how horrific that was. But I'm grateful for the legislation you all passed. That has been key. Not a single member of the legislature voted against that bill. So that shows the real heart of Mississippians, the belief that our children are being going after by these predators, evil forces, no question about it. But you all believed in making a difference, and you voted for that bill because it makes all the sense in the world to have that protection. Now, big tech, you also voted again on this other part of it to protect our children and have consent before our children could go online. We're so appreciative of that. But now here's what's happened. Big tech, all their money, guess what? They pitted our children against their dollars, their engineering, how they can make money off of our children. And we have to stop and realize that this is serious. They've created these social media platforms that are harming our children every time they get on those platforms. They know exactly what they're doing. They understand the algorithms. They understand the bullying, the shaming, the things that they're doing to our children. It's a whole variety of harms that they're bringing on our children. And so we have to keep fighting the good fight. You all passed that legislation and we were ready, and you gave parents the tools. And then, of course, big tech came in to block it. We're going to keep fighting. You know, they sued us the first day that it went into effect. And on Net Choice, we're going to fight that good fight. We're getting ready here very soon to take our argument to the Fifth Circuit. It's the right thing to do. It is all about protecting our children. So I'm grateful that you all did that. And we need to continue to stand strong. Government should be the ally for our children, not the adversary. This is a time to continue to be very bold and strong for our children. And we need to make it clear in our laws too, that parents are in charge of their children, that parents have the rights, the responsibilities, and the accountability for their children. I know you have all considered it in the past, but I'll ask in the 2025 session that you pass the Parents' Bill of Rights. We need that. We need that for our children. It's significant as we continue to move forward. So a simple codification that shows the liberty interest for these children is given to their parents is quite the direction to be in. And I want Mississippi to continue to lead in that format. We should always be instilling the values and the traditions that protect our children. Also coming up in this session, I'd like for you to consider paid maternity leave for state employees. This is an important issue as we look at our state employees. It's an important issue that we step out and again, be there, be very strong in our statement. Other states have done that. I know many times here we look at who else has done that. I just want to tell you that Georgia, Arkansas, Tennessee, Texas, North Carolina, South Carolina, Louisiana, and Virginia have all passed these laws. And so I would encourage you to take a hard look at this. Alabama almost got it to the finish line, and they'll be looking forward to bringing it in the 2025 session for them and passing it in their legislature. Again, important steps that we need to all look at and address for our women. And before I close, I want to talk about something that you all are also very involved in, because this month is Domestic Violence Awareness Month. Again, a very hard topic, but we are talking about, again, our women and our children. My office has made helping families with this a top priority. We've looked at it on every angle on how we could be supportive. There's far too many victims in our state, far too many victims who have children in those homes. So we have to be there supporting them. We also have to help our law enforcement. Again, we should always support our law enforcement. It is critical that on every level, we're there for our law enforcement because they're there for us 24/7. So again, talking with our partners, the Mississippi Domestic Violence Registry was created for our law enforcement. Let me tell you why that's important. We train our law enforcement officers. We do live scenarios, what it would look like if you come into a situation, and be very mindful. There are a lot of ambushes that happen. And right now, we're sending our law enforcement officers into situations. This helps them understand, has there ever been a complaint at this residence before? Does this individual have a different track record, a different part of the state? So that those law enforcement officers know going in, oh, this has happened before. We know there's a record here. So we have created the nation's first protection order registry, which puts both the civil and criminal orders together. Because again, we need to know that. And it's important as we walk into those situations. We partnered with Mississippi Access for Justice to create this step-by-step program. And it helps because you have all the filings for the domestic abuse orders are all filed together. So when you've got a domestic abuse protection order, you can see them all together. We've done it county by county. Again, if you're coming into that scenario, you can look at it again, but you can also look at the situations across the state. There's a very important component to this as well. And we incorporated the lethality assessment protocol. So again, if you're a law enforcement officer, you understand what you're going into, you understand the questions, you can get the environment, you can see what does this look like going in. And again, I know domestic violence is a very key part of what each of you are looking at, and I commend you for making that a part of your legislative agenda priority as we go into 2025. Know that my office is ready, we're willing, we're able, we want to be a big part. We want to continue, as each of you do, to make Mississippi's best day as we work together. And so I appreciate that, because it's not just good enough for any of us in this room. It's not just checking a box. For all of us, it's making a difference. So thank you.
Thank you, General Fitch. Your people have said you were over 5 minutes and that you were due someplace else at a hard stop.
Oh, good. Sorry,
So
lots
we
of
wanna-
territory.
Yeah, we want to thank you, but I'm going to take one quick second just to ask a particular question, because you also are an agency head, and we've looked at this issue of maternity leave for state employees. But we have not really looked at it in regards to a workforce issue. And I know our colleagues in our other states, that is how they approached it, as a workforce issue. You're recruiting young attorneys who are looking at the private sector and the public sector. How much of an issue is this for them as they look at where they're going to accept employment?
This is a critical component. You're right, Senator Boyd. This is about the opportunity to give these young mothers to be in public service. We're talking about retention. We're talking about people that want to serve, but this could be an impediment of whether they take that private sector job versus coming into the public sector. We look at it as a great opportunity to continue. And as you said, those other states looked at that as well. They saw this as a great tool, a great resource to have these women in public service and to keep them there.
Okay, thank you very much. We appreciate you coming for the committee, and we're excited about Mama, and we're excited to see what y'all are doing. Thank you.
Thank you so much. Thank you all.
All right, we're a little bit ahead of schedule, but we're going to go ahead. Are you ready? Yes, good deal. We're going to go ahead and have you start. Are y'all good, or do y'all need to stand up for a second? Okay, let's roll then. Thank you. Y'all, our next speaker is Carla Steckler-Tai, and she is going to be talking from the Children's Advocacy Centers of Mississippi. And we've talked a lot about child welfare today, and child protection. And y'all come into play when things have gone awry. And I know there's a lot that we can do to help y'all in the wonderful work that y'all are doing out in the communities. So tell us.
Okay, will do. And thank you very much for allowing me this opportunity to speak to all of you and be a part of this hearing. I do represent the Children's Advocacy Centers of Mississippi, which is the 14-member statewide association for the child advocacy centers, and they do some really critical work out in the field. Some of you have child advocacy centers in your area and may know a little bit more than others. And so Senator Boyd did ask that I speak a little bit about what we do. And so I'll share a little bit about that, which may be an old hat for some of you, but I will share that information and then a little bit about our statistics and what our needs are right now. So our child advocacy centers coordinate cases in a multidisciplinary team approach in felony level child abuse cases. So we are working very closely with law enforcement, child protective services, medical professionals, prosecutors, mental health professionals, and others that are responding to the investigation, treatment, and prosecution of child abuse cases. Let's see. Do I have the ability to change this? There you go. So you all have a packet in front of you that includes a map of the location of all the child advocacy centers that you may be able to see a little better, but the handprints are where the facilities are located, and then the light colors are the service areas for those child advocacy centers. Because of the many agencies that have to get involved when there are cases of child abuse, the system can often feel very fragmented. I mean, just listening today to all the speakers, you can just, you hear all the various agencies that have to get involved and have an impact on that child's life. So before child advocacy centers existed, abused children navigated a very complex system for reporting and receiving therapeutic care. So all too often, children were being interviewed over and over by multiple professionals. We had kids that were being interviewed dozens of times, sometimes upwards to 30 different times, about something that may be the most horrific thing that's happened to them in their lives. And so this resulted in no conviction for the perpetrator, because you had, this impacted the case by having a child have to tell the story so many times, and often impacted the healing, and a child didn't have access to the therapeutic care that they needed. So our child advocacy centers and multidisciplinary teams were initially created by our partner agencies who saw the need for us to improve the system. Child advocacy centers are designed to assist in coordinating investigations from the start, and this leads to more timely investigations. It allows children to have access to specialized medical services, mental health services, and it reduces duplication. This is really a true public-private partnership. And in Mississippi, we have 13 child advocacy centers who provide direct services to children. We have 1 developing child advocacy center and 3 satellite centers. Earlier today, you heard the judges share that they have over 46,000 reports that they see each year. Well, the Children's Advocacy Centers of Mississippi spring into action in the most complex of these cases. So last year, our Child Advocacy Center saw 8,271 children that were victims of felony level child abuse. So sexual abuse, human trafficking, severe physical abuse, child fatalities, witnessing a violent crime. So we are talking about the children that have experienced some of the worst imaginable abuse. These are the kids who've been raped, that have been sodomized, that have been kept in dog cages. These are the children who have witnessed their siblings being drowned or beaten to death. These are some of the toughest cases that come through the doors of Child Protective Services. And unfortunately, this is most often by somebody that they know very well. So once an investigation has been initiated, the child advocacy centers receive referrals from our investigative agencies. So Child Protective Services, your local law enforcement, the FBI, MBI, the Attorney General's office. And then most recently on a national level, the Department of Defense and our military criminal investigation organizations have established an expectation that all children who are at the center of an abuse allegation and our military dependents will be seen here at a child advocacy center if there's one available. So we now have 7 MOUs with the Army, Navy, Marine Corps, Air Force, and Space Force. So as you can see, most of the children that come through our doors, the allegation is sexual abuse, but obviously there's other forms of abuse, felony physical abuse, witness to violent crime, drug endangerment, child fatalities, with 63% of those being female and 37% being male. Child abuse investigations are a gateway to services for victims. We know that the best long-term predictor for recovery after abuse is not the legal outcome in the case, but it is whether or not that child receives treatment and services. Did you have a question? Oh, sorry. So the Child Advocacy Centers build trust with the family, and maybe working with that family for years to come. So a child may walk through the doors, receive a forensic interview. So they have the opportunity to tell the account of what has happened to them to someone who has had that specialized training. This is done by having law enforcement and child protective services there on the day of the interview. They have the opportunity to then send in questions to the forensic interviewer that will ask those questions in a non-leading, non-suggestive way. We want that interview to hold up to the scrutiny of court later on. We then will provide specialized mental health services. That's either done through a referral to the community mental health if someone at the community mental health has that specialized training. If not, then it may be done there at the local child advocacy center. So we want to make sure that those children have the opportunity to heal. And then they may receive ongoing services like case coordination, court accompaniment, court preparation, to help them receive justice.
Can I ask a question about your map?
Sure.
Okay. Want to make sure I understand. So are all counties covered and those ones in the white?
We have 27, and I'll talk about that in a moment, but we have 27 counties that do not have access to a child advocacy center.
And what did those counties do? Because
many of our child advocacy centers will receive referrals on what we call a courtesy basis, that that children will be interviewed if they have the capacity at that time to serve it. If not, they're probably being interviewed by law enforcement or child protective services. But it would not be a forensic interview.
thank you.
Mm-hmm. So last year we conducted 4,107 forensic interviews, 3,797 specialized mental health services, nearly 26,000 case reviews or coordination. So those are those services where we're pulling together and working with law enforcement, child protective services, and the other agencies that are involved to make sure that those cases are coordinated and we're not duplicating services. And then providing emotional support or safety services to 6,389 children. So that may be support groups, suicide risk assessments, crisis intervention. I was on the phone with a parent this morning that was very upset and, provided that crisis intervention for her. So we know that in addition for the healing for the child, which is absolutely paramount, this model also creates safer communities. So research demonstrates that felony prosecutions of child abuse increase in communities with an established child advocacy center. There are faster decision times to charge criminals with crimes against children. Defendants of convicted sex crimes against children are sentenced to longer prison terms when investigating this multidisciplinary team model. And there is a cost savings to the community, which is just under $1,600 per case. That may not sound like a lot in an individual case, but last year that would have saved Mississippi nearly $13 million. So it is considerably more costly for the state when a child advocacy center does not exist. So I do want to talk about two of our greatest challenges. The first is an inconsistent response across the state from county to county. So currently, every county has a multidisciplinary team operates from an agreed protocol, so an agreed upon child abuse protocol. The challenge is that from county to county, that protocol is different. So in one county, it may be that the multidisciplinary team has determined that every child will receive a forensic interview. In another county, it may be that it's children under the age of 12 will receive a forensic interview. In some counties, the multidisciplinary determines that all felony level cases, felony level crimes against a child will have this multidisciplinary response. And others, it may be particular crimes. So we back in 2022, we sent out a survey to our multidisciplinary teams to assess what the greatest needs were. And overwhelming was that this need for a consistent protocol across the state in our response to child abuse. So we began the work to standardize a statewide child abuse protocol so that we're all working off of the same playbook. So we have partnered with the Children's Justice Act Task Force to develop this standardized protocol. It will help provide continuity across the state, set some minimum state standards, minimize stress for the victim, have some established practices across the state. We did this in the partnership, as I said, with Mississippi Children's Justice Act Task Force. We pulled together a group of experts to develop the standardized response, which included representatives from the Child Protective Services, the Attorney General's Office, mental health, prosecutors, law enforcement, the health department, coroners, our child advocacy centers, judiciary, defense, and other experts who had the experience and knowledge to assess our discrepancies and then help develop guidelines to close the gap. As I said, we have been working on this for the past 3 years, so this has been quite an undertaking to get all of our agencies to agree upon the same procedures and the same language that could be used across the state. This addresses the joint investigation that is required between law enforcement and child protective services in these felony level child abuse cases. And we are looking at the response by child advocacy centers, the ongoing treatment and how those referrals and the procedures will occur with forensic medical exams and clinical services, as well as legal and court considerations. So we are now in the final stages of review by stakeholders, and we will begin training on this and implementing it in 2025. So we expect that we may need legislation in 2026 to help support the adoption of this protocol, but we plan to take this next year to really look at that implementation and any changes or fine tuning that it may need over this next year after we begin implementing that protocol. The other greatest barrier is that we do not have statewide coverage of child advocacy centers. So currently there are 27 counties without access to a child advocacy center. We were very grateful that in 2023, the state legislature awarded $2 million in new funding to support the growth of child advocacy centers. So with that, we added 2 new child advocacy centers, one in Jones County and the other in Lee County. There was also a satellite office that was opened in Neshoba County. And then we are supporting the development of a new center in Bolivar. It has not opened its doors yet, but we do expect that they will open probably in the next 6 months. And then in addition to that, 7 new counties now have access to child advocacy center services. Yes.
With the 7 counties, does that take our total to 20 that don't have access, or?
No.
Still 26. So
It's
that's already
27 now.
included.
I had already factored in the 7. Mhm. So unfortunately, factoring for inflation, the $2 million still does not restore us back to the 2012 per child state funding level that we received. So we are asking in this upcoming year that the state legislature continue to appropriate funding to the child advocacy centers and increase that funding by an additional $1 million this year to help continue our efforts to serve all children across the state. So support at this funding level will allow us to keep the doors open, the lights on. It will help us close the gap in our existing service area to make sure that children have that full array of services to heal from abuse. And it will allow us to continue to support new child advocacy centers as they work to open. Our goal is to ultimately have statewide coverage, and we have analyzed the cost of what that additional facility and staffing will take to provide the full array of services, and we estimate that it would take an additional $7.1 million. So I think it's important to also mention that overall, our federal funding is shrinking while our coverage area at this point is growing. And before I open it up for any questions, I did want to just mention one other project that we have been working on. And I know you have mentioned several times about workforce development this morning and throughout the day. And this has been a huge initiative that we have been working on for the last few years with our colleges and universities, and feel like is a really key solution to the child abuse crisis long-term, and that's child advocacy studies. So we have partnered with our colleges and universities across the state to roll out child advocacy studies, and we now have 28 colleges, community colleges, medical schools, law schools, universities that are beginning to implement the child advocacy studies. So what most of us have known for a long time is that professionals have learned how to manage these complex jobs on the job. So they did not come out of school knowing how to truly respond to these very complex cases. We have teachers that came out of school that were never taught how to identify abuse, much less what to do when a child made an outcry. We have, when we started this project, I had a medical professor tell me that they had 2 sentences in the medical textbook on interpersonal violence. So that's 2 sentences to address sexual abuse, domestic violence, and sexual assault. So we knew we had to do something different here because profession after profession was literally learning on the job when a child's life may hang in the balance. So we decided we needed to move upstream to ensure true systemic changes. And so now we have these 28 schools that are offering the CAS studies. 4 have a minor program, 4 have a certificate program, and the others are working to move towards the minor, their certificate program. The classes are interdisciplinary and have curriculum on how to effectively address child abuse and neglect in the real world applications through a multidisciplinary team response. So you do have social workers taking courses with criminal justice majors who are taking courses with pre-law, pre-med, nursing students. They're all taking these courses together, breaking down those silos that we end up forming when we get out in the workforce. They're breaking those down and learning how to communicate and the role of each profession on the front end. So as a result of this, we have now had nearly 1,700 college students receive training through the Child Advocacy Studies program. And then a key part of this is experiential learning. It is the cornerstone of the CAS model. We want students to apply what they're learning in problem-based simulations. So we want to make sure that students, if they're going to make mistakes, are doing it in a controlled environment. So they can come in. We essentially have now the Child Advocacy Training Institute that was at a request of our colleges and universities. Students can come through, and professionals, and go crime scene to trial. So we have mock residences, we have the mock classroom, courtroom, parents' bedroom, child's room that can be converted over into dorm rooms or camp counselors' rooms, and various residences. And so they actually walk through as a multidisciplinary team and conduct an investigation, have that knock on the door before it is a real child behind that door. So we have had 2,000 students and professionals receive training through our training institute. And I would welcome you all to come. Would love to have this committee come and walk through our simulation center and visit it and see what it's all about, because it is incredibly powerful to walk through that facility and see firsthand what many of our children are living in every single day across the state. And it is equally powerful to realize what our professionals face when they have to go and knock on that door. So thank you for allowing me the opportunity to talk about the work of the Children's Advocacy Centers and the Child Advocacy Studies. We want to continue this work, and our most pressing need at this point is additional funding to be able to close that gap, to be able to have statewide coverage of child advocacy centers.
I know 2 years ago, I believe, we were having tremendous amounts of trouble with your federal funding and the flow through of that. And can you tell me where we are in the status of all of that? Can you update the committee? I know that there were some tremendous issues with that.
So the federal funding is still decreasing. So that's, I believe you're referring to the Victims of Crime Act funding. And
That's why they're asking for the.
So, I mean, we've received significant cuts. A few years ago, it was a 42% cut. I think this next year, upcoming year, it's gonna be another 5% cut. So the dollars the federal dollars are going down. I know that there's a lot of work on the Hill to try and to address that, But it's still a challenge with having enough money to be able to serve the victims across the state.
Additional questions? Senator Turner Ford.
Thank you, Madam Chair. What is the objective of the CAS studies? Is it to train individuals who work with children? Is there a certification?
So there's a certificate, you can either get a certification or a minor. And the goal was to create a better prepared workforce. So we saw the challenges that was happening, that so many students were well-meaning, got a degree in social work and go work for Child Protective Services, get there and realize this is not for me. This was not what I thought this was going to be, and may have been in a better fit over in criminal justice or someplace else. And the opposite is, we see the opposite happening. Sometimes students are coming through and we're in criminal justice and suddenly say, wait a minute, I'd be better fit over in working for Child Protective Services. But ultimately it was to prepare our workforce for these types of cases. Attorneys are going through, law school and aren't going to learn how to prosecute a case until you get to the district attorney's office. We were seeing that in every single profession, that they just weren't prepared. Physicians weren't prepared to see the types of these children when they're walking through their doors and there's suspected abuse. What do they do? So we wanted all anybody who'd be interacting with a child to then have this be well prepared, but it's primarily targeted towards those that may end up in a child welfare type field. But I will say it has been embraced by much more broadly than that. It makes better jurors. It's when we went around and talked to the colleges and universities, we had one dean at one of the colleges say to me, I want all of our culinary students to go through this. And I couldn't figure out why culinary. And when we asked about it, he said, we have camps all summer long on our campus. We have football camps, cheerleading camps, and those culinary students are the ones interacting with kids. So they need to know what to do if a kid makes an outcry, or how to make a report. And so we see faith leaders taking the courses, our future faith leaders, because you think about how many individuals are going to be making an outcry that are in their church, or again, it's so broad. The nursing students, our last semester, we had an accounting student who said it was the best class that she's taken, but she's also working for a nonprofit, and so it was a good fit.
I was just wondering if there are opportunities to perhaps formulate courses for juvenile justice training. I know there are some requirements for prosecutors and those who work with the youth court system, if there's the potential to fashion this to correlate with what's required for other.
So some of our community colleges are really targeting that ongoing workforce development. So professionals that need ongoing training, or maybe going back into receiving additional training. I think this can be fashioned in a lot of ways, but on the college campus, what we're seeing is that the community colleges are really getting those existing workforce that are coming back for additional training. Our four-year colleges are getting the new workforce, but they all have some type of experiential learning, where they may even be going online and getting access to a simulation, so they don't have to come through and walk through in person. They may be doing this through virtual reality or some other online tool.
Thank you.
Just quickly, my question is, what does the labor force look like for you guys? Like, are you fully staffed? Is it difficult to hire people? I know we didn't talk about this, but I just kind of want to know. And then what are the areas that you're competing with people with? Are you able to pay competitive wages and all of that kind of stuff?
I think the area that is we see the most challenges in mental health, and for two reasons. During the COVID epidemic, and then the VOCA cuts came. And they came fast and hard. And what our child advocacy centers ended up doing is taking an assessment and saying, where can we make cuts? and let's look at what other resources we have in the community. So the first line that was laid off were our mental health professionals that worked at child advocacy centers. And because so many of our community mental health centers had therapists that they could refer them to. Unfortunately, as I said earlier, they don't all have that specialized training. And so that's one of the greatest areas of need for us. We have seen as with the 2 million coming back and trying to secure other funding, that has been the area that we are rehiring because it was the first line that had layoffs during those cuts. And I would say that is also the area where we have the most competition because someone may come in, they receive the specialized training, and then they're very marketable to be able to go out and go into private practice. So, we have some dedicated professionals that have been with child advocacy centers for years and years and years, but the mental health side is one of our greatest areas of needs.
I just want to make a comment that I appreciate the work you guys do. I have been on the other side of your work as a defense attorney, and I can say it is great work, horrible for me as a defense attorney, but great for me as a citizen who wants these people taken off the street. So thank you for the work that you guys are doing.
Thank you.
Hi, Carla. So I probably could have just called you, but I'm gonna take the opportunity on this. It keeps coming up. So a few years ago, excuse me, we put the forensic interviews under the Youth Court Act.
Mhm.
Apparently that's led to friction between judges. And I'll just tell you, probably 3 or 4 weeks ago, in the Canopy folks down in my area, they who run the forensic interviews, they gave me the long muddled stuff going on down there because, in short, it's between Chancery courts and the youth courts. And there's like a battle between that to get the forensic interviews. Do you know what I'm talking about?
I do. So a few years.
And so why, and can we just fix it?
Well, I'm actually surprised to hear it because we have not heard as much about this lately because in the last legislative session, I think last year or the year before, we addressed this through there were some prosecutors that made some
but now it's
changes.
Chancery Court. So now chancellors don't, I'm going to say it this way, chancellors don't like going and bending the knee to the youth court and saying, I want to get a copy of the forensic interview.
So ultimately, what the question is about is the protection of the forensic interview. And we put in some protections in the law a few years ago because what we were seeing happen is the forensic interview were getting out without a protective order. And these kids are talking about some of the most horrific things that have ever happened to them. And it needs a protection over that. So there is probably a solution that we can have there. But ultimately, what the law says is that even the chancellors would put in a protective order in the
Right. And so that it's
interview.
clear, it's not just my area. I've heard it from other places too.
And the records are considered youth court records. They are records involving children. And so I think this also goes back to our system, the discussion from this morning with the inconsistency from county to county.
Well, okay, so I appreciate that because how it works, or as it's been explained, is if you have the forensic interviews come about if there's a report to CPS or law enforcement or something. But then you have Chancery courts who, through the Chancery process, which are private litigants, comes up and some child's been touched or something. And so then they'll order a forensic interview, or somebody somewhere will go get a forensic interview, and it's not actually going through the criminal process. And so then the chancellor's like, I ordered it, I'm protecting the child, blah, blah. Sorry, I'm protecting the child and all that. And I'm a chancellor and I'm hereby ordering the forensic interview. And then the youth court judge goes, nope, you've got to come over to me and you've got to file a motion to get the forensic interview. And so you have this back and forth. In the meantime, the child's caught in the middle, and the whole, you probably seem to know what I'm talking about. So is
Well,
that, can
and-
we?
Yes,
can
and we do see this with even chancellors, they may order the forensic interview and they are acting as the youth court. And so, you know, you have a referee, they may choose to retain that case and act as the youth court judge. And so then they can put in an order to them for a protection of the record.
But, okay, and so you're right. I think this is an example of our system that we were talking about earlier with
Right.
investigating and doing all this youth court. And so whatever, the various courts are fighting over it. In the meantime, the child's not getting relief and we're not getting it there. So
Right.
we may need to look at that.
I'm sure there's a solution we can come up with.
Okay. And
Senator, is that my understanding? The courts in the situation, is the chancellor still able to access that information from the youth court?
no, well, okay, under the law, under the
Right.
youth court law, it gives the youth, it's a youth court record.
Right.
Okay, and you have to, anybody who wants access, and there's only certain people,
Right.
has to file a motion and all that. So what's happening is the youth court judge in jurisdictions are going to say, no, Mr. Chancellor, you can't have it. And the chancellor's going, wait a minute, I'm the chancellor, I ordered it, I want it. And so that you know this goes to what Carla was saying, this happened in a certain area where the prosecutors, the DA's office, wanted the forensic interview, and there was a fight between the youth court judge and the DA's office. And so we ended up doing a bill for that limited exception to allow that, but that was because it was coming. So now we're seeing it in the chancery side of this.
We're gonna
And
have to
yes,
look
they
at it.
can get it, but things being what they are, what I've heard is, well, it's either not being given to me or I don't want to do what they say I have to do.
Right.
Is
Not
that-
wanting
it-
to make the request of another judge for the.
Correct. And
For the
then,
record.
and then, okay, and then what was explained to me in my local area was, so if that happens, then because the CAC is under Canopy, Canopy has their own policies and procedures. And so then the judges go, I don't want to follow Canopy's, by gosh, I'm a judge, I'm issuing an order. And then the attorneys for Canopy say, we have all these other things we've got to look at. And so then it becomes this whole thing. Is that, I'm looking at your face.
Yeah, my face says it all too, about all of that, so. Okay.
But yes, it's going on. So I appreciate Carla answering that because it does seem to be occurring.
Can't we all just get along? Anyway.
Well, and I think that's ultimately what we want. I mean, we want the system to work well, and we don't want to be a barrier to the system, to someone getting the records that they need. We also want a system where a child's case isn't going to end up, a child's forensic interview isn't going to end up on social media. A child's not going to commit suicide because suddenly a lot of individuals have seen this case, seen their interview that they shouldn't have seen, which is why there's a necessity to have a system in which those records are protected and that they have,
The policy is good. It's how things are going. And then like in my area, which is Campy, but in another area, some other entity may be overseeing the CAC and there may be some other different policy or something.
Additional questions? Okay, thank you very much. This is
thank you.
enlightening on us. So thank y'all very much. And that concludes us for the day. We will meet again at 9 o'clock in the morning. Thank y'all.